Representative Javner, can you talk? I'm sorry. Thank you. Okay, so we're getting organized. If people would be kind enough, the representatives would be kind enough to come to the AFA room so we can have a quorum, and then you can go back to your specific rooms. Yes, but I'd like everybody to come here just so we're all together, and then you can go back to your specific rooms. Yeah. Representative Javner, I still can't hear you nor see you. This is a very poor contact with Representative Javner.
I apologize.
Representative Javner, this is not working at the current time. Is there a different place you can go? Or you could call in by phone?
Yeah, we can check that out. It's probably still not muted. I don't know. I thought you all were. Just put it back. Okay, let's check her out again.
Representative Javner, we're still waiting to, we're going to start in a couple of minutes. So still waiting to hear from you. Can you speak, Representative Javner?
Morning, Senator.
This is right. It's a very poor connection. It's very garbled. No, you're speaking some foreign language.
Sarah, when she can fix that, can she get on the phone? Just use the phone?
Anthony, is there a phone number she can use, Anthony?
I'm sending her the message that was on the Zoom link with the
good.
phone number so that you could try doing that.
Thank you.
Can somebody text her? Can somebody text her or connect with her some other way to help her
I
establish
am
something?
doing that right now, Patty. I'm doing that right now.
Okay, thank you.
Donna Bailey, Molly, Elizabeth Reardon is on. I think we have. Harry, I think we have everybody here except for Holly's gone away again. I think we should start.
Let's work out Kathy Jasper, otherwise we're gonna spend time doing that.
I think if she's well from Wisconsin, she has.
Connecting to audio now. So let's see if we can.
Representative Javner, are you hearing us? I'm sorry, I missed that. What did you say?
If you're connecting to a phone, make sure you have the Wi-Fi in the room.
Oh, right.
Holly, do you feel good about where you are and connection, all that stuff? Great.
We're still waiting for. I think we should start in, and we again have 5 minutes while we're going. we have to go. Good morning, all. This is a regularly scheduled meeting of the Health and Human Services Committee. I'm Senator Jeff Gratwick, will be presiding over the work session today. And this is a somewhat unusual circumstances. I think everybody is aware. We'll do our very best to be all-inclusive and transparent, but unusual problems. If you have a difficulty, please either raise your hand or let Nick or Anthony know. We have to, first of all, have a quorum present, and so I'm going to call the roll of those I see present, just so if you'll say you're present, and then as long as we have over 7 or more people, we're all set for a quorum, and then we're going to divide up into different rooms. Representative Stover, here? Here? Representative Meyer? Representative Perry? Here. Senator Claxton? Here. Senator Gratwick? Here. Representative Hymanson?
Here.
Representative, yes, Craven? Here. Representative Madigan? Here. And Representative Griffin? So we have a quorum. So we are now going to be at ease while people go to their rooms. We'll start in 3 minutes. We're still waiting for, we're going to still hope to get Representative Schaffner with us. So I'm just checking in for Representative Stover and Madigan. I see Javner is we're still waiting on Representative Javner, connecting to audio. And
I'm here.
Is it Representative Javner? Not yet.
Good morning, Senator Gratwick.
Good. Oh, welcome, welcome. Well, I think we're all President,
Reset my system. This is Representative
yeah,
Gavner.
you are. I'm a happy man. What can I tell you? So, right, that's okay. So then, thank you all. So this is the beginning of the work part of our session today. And just to review a few of the basic rules. First of all, thank you all for making these extra efforts today. We're going to first go through our introductions and then go through some of the rules and regulations, and then we're going to start in through 3 work sessions. So if we start at the end of the horseshoe, which is Michelle Meyer, Representative Meyer.
Thank you, Senator. I am Representative Michelle Meyer, serving Southern Maine's District 2, which is Elliott and parts of South Berwick and Kittery.
Thank you. Next. Where's Representative Stover?
Good morning, Holly Stover. I represent District 89, the towns of Boothbay, Boothbay Harbor, Southport Edgecombe, South Bristol, and Westport Island.
Thank you. Representative Chapman.
Good morning. I'm Representative Kathy Japner, and I represent District 141, which is located in Penobscot and Washington County.
Thank you. And the lady in front of her garden, Representative Perry.
Hello, I'm Representative Perry. I represent House District 140, which includes Indian Township, Baileyville, Barron, Callis, Charlotte, Robinson, Perry, Pembroke, and Pleasant Point.
I'm Ned Claxton.
Well, we forgot Representative O'Connor.
Good morning. I am Representative Beth O'Connor, representing House District 5, which is Berwick and part of North Berwick.
Thank you. Senator.
Thank you, Mr. Chair. I'm Ned Claxton. I represent Senate District 20, which is Auburn, Minot, Mechanic Falls, Poland, and New Gloucester.
Representative Hymanson.
I'm Representative Hymanson. I represent House District 4, which is parts of York, Wells, Sanford, and all of Ogunquit. I'm House Chair.
Senator Moore.
Good morning. This is Mary Ann Moore, and I represent Senate District 6, which is all of Washington County, as well as Goldsboro, Winter Harbor, Sullivan, and Sullivan and Hancock County as well.
Thank you. Representative Madigan. Representative Madigan, you're muted. If you'd be kind enough to unmute yourself. Representative Madigan will unmute herself.
Hi, I'm Representative Colleen Madigan. I represent House District 110, which is about half of Waterville and a little bit of Oakland.
Thank you. Next, Representative Griffin.
No, it's me.
Oh, that's
Good
Craven.
morning.
I'm
I'm
sorry,
Margaret
Representative Craven. I forgot you again.
I'm Margaret Craven, and I represent House District.
You have to unmute yourself. Sorry,
No,
Representative
she
Craven.
doesn't.
Oh,
Yes, she
my
does.
fault. You're
Okay.
right. I'm wrong.
Good morning. I'm Margaret Craven, and I represent House District 59, which is part of Lewiston.
And then Representative Griffin.
Good morning. My name is Abigail Griffin. I represent House District 102, which is Glenburn, Levant, and Cadetsgate.
Thank you very much. And I think absent is Representative Talbot Ross, who is at another committee meeting at this time. And then we are joined by our analysts, Anna Brum and Aaron Dooling, and Allison Bernier is our committee clerk, who is here as well on the campus, but not in this room. So just a few general things I think we're all aware of: the use of masks, the 6-foot distancing, which, as someone just said, we can be that close in Maine, which is quite something. We've gone through the self-screening in terms of illnesses. I think that's very important. What I'm doing now is just going over some of the rules and regulations that the Legislative Council has gone over. All the members are on Zoom now, as well as a few others who will be testifying. People can watch with YouTube as being recorded, but there are no other possibilities of communicating at this time during this hearing. When we vote, we're going to have one time when we have to be physically present. Those who are here in the State House have to come back to this room, the AFA room, be physically present. So our pattern is going to be to have 3 work sessions. And then at the end of each, we're going to, people will make a motion, which will then be tabled, and we'll come back into the room and take them off the table and vote all 3 in order. So we just have to come back once. Following that, we will then go through amendment reviews that are fairly straightforward. For the most part, given the fact that this is all new territory, if you have any questions, please either put the hand up on your Zoom screen or wave your hand repeatedly to get Representative Hymanson's or my attention. So any questions at all from any of the committee members as to the logistics of what we're doing? Other than that, I'll then turn it over to Representative Hymanson to do the first of the 3 work sessions.
Okay, so again, this is all brand new. We are the first committee that's doing these meetings in this format. So off we go. I'm going to open up a work session for LD 2135.
Other than that, I'll then turn it over to Representative Hymanson to do.
Okay, I'm not sure what just happened, but I'm just going to continue. 2135 is an act to amend the definition of tobacco product to exclude matches and lighters. And as I've been told, everything, all the new material we have is already put into the folders we have on our desks. So you'll notice there is not any new material, but we do have 2 people to remind us about this, because that's the other thing. We haven't been in the committee for a while. And so reminders about these bills. We chose 3 easy bills so that we could try this format out. But I see that Elizabeth Reardon and the sponsor, Donna Bailey, are on our Zoom meetings. So I'm going to ask Elizabeth Reardon from the AG's office to remind us about what the current law is around the issue of expanding the definition to make it clearer that matches and lighters are not, can be differentiated, so, or should be differentiated. So I'm going to ask Elizabeth Reardon to unmute.
I'm ready.
Wonderful. Hello there.
Hi, how are you?
I'm good. I'm good. Thank you. If I can just say to the committee, so Elizabeth is from the AG's office. If you would like to ask her questions, please raise your hand like this, and I will call on you. Thank you.
So it looks like this bill is, as you said, seeking to add some language to specify that matches and lighters or similar devices are not considered tobacco products and therefore are not subject to age restrictions. As it stands, the Attorney General's office does not and has never considered those to be tobacco products. So that's where we're coming from, but I'm happy to answer any questions on this issue.
Okay. Can you remind us about your work with the AG's office in this regard?
So I work on tobacco issues, meaning I work on the enforcement of tobacco laws in addition to working on the master settlement agreement and any subsequent conversations about funds coming from tobacco companies into the state. So in terms of this bill, I am the person in the Attorney General's office who would be speaking with or working with retailers on this issue.
Have you ever fielded phone calls from retailers about this issue?
I have not.
Any other questions for Ms. Reardon? Thank you.
Yeah, yeah.
Oh, Senator Gratwick?
So, thank you for being here, Ms. Reardon. What do you recommend in the future if we do not pass this bill and other people have difficulty? What do you recommend as recourse for the citizen who refuse the matches? And what do you recommend for stores?
Sure.
So they understand the true intent of the law.
So it seems to me that this is an education issue that retailers may need a better understanding. However, I also understand that there is at least one, if not two, larger chains that service the state that choose not to sell below that age. And as I understand it, there is no problem as long as it's a policy across the entire, I believe it's Shaw's, I believe all Shaw's choose not to sell matches and lighters to anyone under 21. And that they can have that store policy as long as it's consistent. So it's a combination of, for stores that want to be selling, an understanding of what a tobacco product is. And our office, in conjunction with the CDC, sends out quite a bit of educational materials and have a lot of online resources, as well as partners in the field who are good resources for stores in terms of education as to what they can and cannot sell, as well as whatever policy on a nationwide or chain-wide basis.
Would there be any harm to adding clarification language like just matches and lighters? The similar devices I know is overly broad, but would there be any harm done to clarify matches and lighters?
So I don't know that there's any particular harm. My instinct is to suggest not changing the tobacco product definition. Maine has one of the strongest definitions. It's allowed us to be ahead of the game in terms of vaping in a way that many states have had to go back and redefine things. So generally speaking, my advice would be not to change this very strong definition that you worked hard to put into place. But being that we have never interpreted it to include those things, as long as I don't know what similar devices would be, but as long as it were limited to matches and lighters, I don't know what the particular harm in that case would be, other than opening this moment where we could change it further.
Okay. Any other questions for Ms. Some reason my Zoom meeting I lost it and it just came back on. So I don't know what happened, but I'm back on. I understand yours did too. I understand that if there are too many people with video, that the connection becomes unstable. So we'll have to watch that. I know that from AFA, and they were turning off video feeds to make it more stable, but I don't know that that's what's happening. Okay, so thank you. Any other questions for Ms. Reardon? Seeing none, I'd like to move to the sponsor, Donna Bailey. Would you like to come up to the mic, Representative Bailey?
Thank you, Representative Hymanson. Coming up to the mic from the safety of my home. My name is Representative Donna Bailey. I represent House District 14, which is part of the incredible city of Saco. All I would say is just to remind the committee that where this bill came from was a concern expressed to me by two constituents who had trouble. They were under 21 and were refused. One was refused the purchase of a grill lighter, and the other was refused the purchase of matches. Now, I will say, based on AAG Reardon, that one of those incidents did take place in Shaw's. So perhaps that is a policy, a store policy. The other one, though, the grill lighter, sorry, I know was at Cumberland Farms. And that constituent, at least as reported to me, was told that Cumberland Farms refused to sell him that because they interpreted the new language broadly to include anything used or could be used with tobacco products. And so that's why they refused him. So that's what this bill is trying to address. And I'm more than happy to answer any other questions that committee members may have.
Are there any questions for Representative Bailey? Senator Claxton.
Yes, Representative Bailey, would you be comfortable with just the phrase "or matches or lighters"?
Yes,
and
I would.
eliminate? Okay. Thank
Yes.
you.
Okay. Thank you. Any other questions for Representative Bailey? Seeing none.
Thank you.
So I'm looking to the committee now for a discussion about this bill. Anyone want to start? Have something to say? If we don't, it might be a good time to practice the following, which is that we take a break and we can talk about the bill in caucus and then come back. So again, this is a good trial for us. So we're going to take a break, which means that you turn off your video and come down to the AFA, and we will go from there. Yes, Representative
I
Perry.
think there has to be the ability for those who are not physically present to go into a chat room.
Okay, all right, so,
I have a question.
yes, Senator Claxton.
My understanding from yesterday was that we were going to work the bills as a work session and then come up with a motion and then go discuss once, as opposed to going in and out after each bill. That's what I recollect from yesterday. Is that wrong?
Okay, we can do that. We were going to vote that way, but we could take a break and talk about all of them at once. Okay. All right.
Thank you.
Why don't we do that? We're looking for ways so that we don't keep breaking and come back and forth. So
I also wish to be sure that Representative Griffin, who's here, has more to caucus with than just Representative Griffin.
that's where we can work out a chat room for them. All right, we'll have IT do that.
Howdy.
Seeing that there is no chat room.
I moved to table.
All right, so we're going to table the bill now, if the vote holds, and then we will come back to it.
My internet went down. What was the vote?
All right, so we have it. We've just been discussing what our next move is, and I think what we're going to do is table, and then when we get finished with all three of these bills, then we'll take a break, and then we'll come back.
So there was no motion made other than tabling.
We need a tabling motion.
Okay.
Just a point of clarification and process.
Yes.
Do we need a motion to be tabled first? Because at this point, we don't have a motion. Nobody's made the motion. This bill ought to pass.
We just need a tabling. We need a tabling motion so we can talk about this.
I think you're correct. We need to have a motion on the table.
I think you table a motion. You don't table action.
Right.
Well, we're just going to table it so that we can come back and talk about it. Unless somebody wants to make a motion now. Yeah, so we're just going to table the whole bill right now until we talk about it. All right, so I'm looking for a tabling motion to table 2135.
So I wish to move. I move that it be tabled.
Second.
All right, it's a non-debatable motion. All in favor of tabling 2135? Raise your hand. Oh. All right, it's unanimous and we will table this. Yeah. All right, well. We can put this aside without a motion, without a vote on the table. All right, so next is is LD 2137. And LD 2137 is a resolve to increase the reimbursement rates for home-based services. I'm looking for new information here, and I don't see new information. But this is a bill that
there's a lot of new information in your folder, Representative Hymanson. If you just open it up, you will see a whole lot of things on the top.
Okay, I don't have new information on the top.
They may have actually ended up at the back of the folders when I was filing them this morning.
There should be a memo from Molly. Yes, there's that. There's also a fiscal note, and I believe there's another piece of testimony. So you should have 4 things.
Okay. Anna, could you take a moment to walk us through this new information that we have so we're on board with what we have?
Okay, so you have a memo from Molly, which she will address shortly, and it's dated July 10th. You asked me for the blue sheet. You asked me for some information about what had happened with rates in the supplemental budget,
Right,
as
so
well.
I don't see a memo from Molly.
It might be in the back of your folder.
That's where I found mine.
That's where I found mine. Like the last page.
I don't have it.
I only have mine.
Does everyone have the letter from Molly?
For those of you that are at home, it's also posted on the website, as well as in your email.
Oh, it's a memorandum. It says to Health and Human Services Committee, July 10th, 2020.
Yes,
is that it?
that's
Okay.
right. Yep.
All right. So it's on the letterhead. It's on the executive branch letterhead.
Yep.
Does everyone have that? Okay, great.
So then you also have a blue chart, and that's because you asked me for a chart or something that showed you what had happened in the supplemental, as well as what was in LD 2109, which is an amendment that you will be reviewing today. Yep. And as well as what's in this bill. And then you also have the fiscal note, because you would also want to be able to look at that. So this bill is changing rates for 3 or 4, 5 sections of, well, some of them are main care. So there's section 19, which is the elderly and disability waiver, and there are some rates for 40 that are going up by 40% and some that are going up by 53.5%. These are all direct care rates. Then section 96, which is private duty nursing, but this is also the personal care services piece. So this is the direct care worker PSS side, CNAs. And then section 12, which is the self-directed, consumer-directed section, which just has the attendant care services. And then there are the state-funded programs, which is chapter 11, which is the state-funded equivalent of section 12. So there's a consumer-directed main care side and a consumer-directed state-funded side. And then section 63, which is the state-funded side that is equivalent to section 19 and 96. And so some of the rates are going up by 40%, some of them are going up by 53.5%, and they are all direct care services. On the chart, you can see, and I should just take a step back, that all of these rates are the home and community-based and elderly and disability side. So this is not including the developmental disability home and community-based services. So that's what's in this bill, and that's what's in your packet. Molly can probably be more specific about some of the details of what was in the supplemental, which were there's a lot of rates that are in the supplemental that are not included in this bill, because that the supplemental also includes some on section 20, 18, 20, 21, and 29. And you also heard about, and those are permanent rates. Those are ones that went forward in the budget and stay, and the department put some of those into effect earlier than they were originally slated in the budget. And then you also heard about the temporary rates that were a response from the federal money, and Molly can talk much more about that. And then just the reminder that when you get to LD 2109, I only raise this now because it's in the chart, LD 2109 is trying to get at all of the direct care services, both on the home and community-based side and also on the residential side. So that's why the fiscal notes look entirely different from each other. So the rate increases are much lower in 2109 than they are in this bill, but this bill is targeted at the the disability and elderly side. But Molly can go through more specifically her memo with you.
Okay. All right, thank you. And I'm also seeing this letter from Home Care and Hospice Alliance of Maine, from Lori Belden, the Executive Director, and in support. Section 96, 12, 19, and 63. And just for the committee, as a reminder, this bill came from Senator Bellows, who I think is in the chat room, maybe, if she is SB iPhone. Okay, great. So I'm going to ask Senator Bellows to come on in and talk to us about this bill. And as a reminder, we've been far away from these bills for a while, so I think we're also in catch-up mode. So if you could, Senator Bellows, remind us the genesis of this bill and how it's been going forward. There's been some efforts by the department to do some kind of funding. So if you know that history, that would be helpful as well.
Sure. Can folks hear me? I'm in the car. Unfortunately, a family member is in the hospital, so we're on the way to the hospital. It's not ideal. But can you hear me okay?
Yes, we can hear you fine.
Okay. So the genesis of this bill, it was an emergency bill brought because there had been some long-time concern about home care rates. I had actually brought a non-emergency bill the prior year to study and look at those rates because of concerns from the providers that they weren't able to meet costs. And then that came to a head when Home Care for Maine, the largest nonprofit provider of home care services under these sections that are enumerated in the bill, announced that it was closing its doors because it simply couldn't meet the cost of doing business, even as a not-for-profit. So we brought this bill as an emergency to increase these rates. And when we passed the COVID-19 emergency budget, fortunately, there were increases in the rates, some of which were permanent or ongoing, although some of which, and this is enumerated in Lori Belden's letter, expired on May 31st. So that was good news and very helpful to the home care providers. But as the Home Care and Hospice Alliance spells out in their letter, they felt that the permanent increases were insufficient and the ones that are temporary need to be made permanent. So that's where the bill came from. That was the situation we were in. I would say that home care services, like so many of these personal support and direct care services, remain very precarious. and very important given the pandemic.
So thank you for that. We have an updated a fiscal note. And is there anything about the bill that you would change given where we've come through COVID?
I would defer to the Home Care and Hospice Alliance in terms of specific changes to the bill. The one thing I have heard, and hopefully your other bill addresses this, there's some significant concern about services for direct care workers providing services to those with intellectual and developmental disabilities, and the fact that their rate increases were temporary. And I know Section 19, which is covered in my bill, applies to adults with disabilities, but there are other sections of services that are important to the disability community that I think also need to be addressed as we look at the budget. And I think the COVID emergency makes these types of services for vulnerable populations even more important. You know, seniors, home-based services are the safest services we can do. And for when we look at the data in terms of outbreaks with seniors and outbreaks with the group homes with people with intellectual and developmental disabilities, it's very concerning. Clearly, to the extent that we can stabilize the direct care, nursing, and personal support staff workforces and adequately resource the providers so that they can, you know, continue to cover the costs of PPE and safety measures, I think that's really, really important.
Thank you. Are there questions from the committee to Senator Bellows? Representative Perry?
Actually, it's not to Senator Bellows. I'm just going over some papers and I have a question. This was in the older papers that talks about the increases proposed, and there's a number in T1005, H0045, and well, a couple of others, and it says to exceed the cap. And is that cap, and I guess the question is this the cap that we have talked about before, that we don't get reimbursement if we go above a certain price?
Upper payment
And that's
limit.
probably for Anna or Aaron.
Yeah.
Because
That's
when I look at this and then I look at this, this is, and this is one that we received earlier.
I'm not sure, Representative Perry, which piece of paper you're looking at, but it may also be there's a cap on I don't know whether this applies here or not, but sometimes there are a cap on services. So if you increase the rates, then your dollar amount, you know, is a problem. And often we put in language so that that doesn't happen. But I don't know. I don't know. Maybe Molly knows. I'm not quite sure which piece of paper you're looking at. Who's it from?
The paper I'm looking at was earlier, you know, when we were in all full time.
But who is it from?
It's on a blue sheet.
Oh, it's my blue sheet?
This one.
It's on a blue sheet.
This blue sheet that says LD 2137, section 19. There are procedure codes and modifiers.
Right.
And the last column says rates affected. And at the bottom, there are some of them that say cost not to exceed the cap, not to exceed cap. But I think that's different from the upper payment limit.
Okay, that's what I was wondering.
The upper payment limit is different. I think this probably just has a cap to it.
I guess what I'm wondering is why is this put on some of them and not others? Does it mean we're exceeding the cap, or that you can only go this far in order not to exceed the cap?
I'm not sure if there's an answer to that. Is there anyone who can plug away at that question? Well, maybe if we have, I'm going to ask Molly to come in and talk to us about the memo. And the idea really is there's a lot that's gone on since these bills have been put before us. And so I was hoping that Molly could talk about what kinds of conversations, what stakeholder groups have been meeting, what kinds of conversations have been happening, and anything else she can fill us in terms of the need for this as a funding bill to put on the table for appropriations.
Sure. Good morning. Molly Bogart, Director of Government Relations for the department. Thanks for having me. I shared via Anna and Aaron, thank you, three different pieces of, well, three different memos. The first is the one that is on our letterhead and is titled Main Care Rate Changes from Supplemental Budget and COVID-19 Response. And largely these are just to provide you with some background information as you're thinking about rates. I think there was a lot that was done in the supplemental budget, and then a lot since then that the department has done, the administration has done on, you know, of our own accord through work with the Center for Medicare and Medicaid Services and the federal government for pandemic response work. And so this memo outlines both the increases through the supplemental budget, which I do just want to clarify that all increases in the supplemental budget are permanent, but the temporary rate increases that are pandemic response related, the majority of those did end May 31st, which I believe was the date that was referenced. And so these three memos give you some information about what the rates used to be for a lot of the services you increased in the supplemental, as well as what the new rates look like, both for the rates included in Senator Bella's bill and others related to home care services, but also, I think as Anna mentioned, other services that you increased in the supplemental budget. So that includes some behavioral health rates through Section 65, as well as some rates for sections 18 and 20, which are adults with disabilities and brain injury and other related conditions, as well as 21 and 29. And as Representative Hymanson mentioned, there are some additional rates that we have done that were specific to the pandemic, and those through what is called an Appendix K. And those targeted some of what Senator Bella's bill touches on, but also some of the other rates for adults with disabilities. Those are the two other documents that I believe you have. One is dated May 13th and one is dated May 29th. And those list the services that were increased on a temporary basis from March 1st to May 31st, and the increases that they received, all about 10%. So I'm more than...
Could you go through this memo kind of page by page to just to allow us to cone in on these, because there's a lot of numbers here and a lot of, and just for the committee, the K waiver are temporary. We applied for a K waiver. Molly, stop me if I'm wrong. We applied for a K waiver and that was granted, and that gave us temporary increases in a number of places that needed money infusion because of the COVID response. But
yeah,
the
exactly. Exactly. It's called an Appendix K. It's a portion of a disaster state plan amendment to CMS. And that is something that I think a vast majority of states have been using to help provide additional financial supports to providers for a lot of the extra and different work that they're having to do during COVID-19, whether that's gearing up for telehealth services, whether that's increasing their amount of personal protective equipment, or needing interim staffing if they have staff members who are not able to come to work if they're sick, or if they have contact with a COVID positive case. And so those are temporary financial supports that we applied to the federal government for those services.
And those K, the Appendix K is only effective until May 31st. So all of that increase has gone away now?
Well, the general rate increases ended May 31st. There are a number of other administrative and quarantine rates that are still available. So there's a higher quarantine rate available for providers if they have a client who needs to be quarantined due to COVID-19. And there are also some administrative opportunities, such as, funding a family to take maybe their child or a family member who's been in a group home, allowing the provider to pay that family to take them back into their home for a period of time to better meet their needs in a way that works for the provider and the client during the pandemic. And so there are some parts of the Appendix K that are continuing past May 31st, but the 10% temporary rate increases did end May 31st.
Okay, so if we could go back just to, if you could go through this document page by page, just so that we get settled into it, that would be really helpful.
Yeah, I think Representative Meyer might have a question. But.
Who is?
I do, Patty.
Oh, okay, you're stuck. You're stuck, which probably means we have too many Zoom boxes open, but we can hear you. We just see you with your head down looking studious.
You can hear me now?
Yes.
Okay, so my question to Molly was, are there any opportunities to extend that hard stop on 5/31? Have any other states extended those temporary services beyond 5/31?
So the services some of the services have been extended, but the rate.
The rate, I mean, yeah.
Just want to make sure we're on the same page. I'm honestly not sure what some other states have done. It was something that the administration considered, and given the end of the stay-at-home order toward the end of May, as well as financial considerations that we're all looking at as the economy is in turmoil, determined that we would not be extending them.
Thank you.
Other questions for Molly before we examine this document a little bit more carefully? Okay, Molly, if you could look at this memo with us.
Sure. So I will sort of orient you to each of the sections, and then if you have specific questions, I'll ask you to ask them to me rather than walking you through every number, if that makes sense. Okay, I'm seeing a couple head nods. Great. So again, the sheet that I'm on is the one that has memorandum at the top. It starts with temporary rate increases and outbreak rates for congregate care. So the first section is nursing facilities, as well as a selection of PNMIs, residential care and mental health facilities, and some substance use disorders facilities. That first table right there shows you the amount increase above the regular rate per day for these per day per person for these facilities. And then the second table there is for PNMI Appendix Bs, which are the substance use PNMIs, inpatient care.
So when you say when they're temporary rate increases, so they have also gone away May 31st?
Yes, yeah.
Okay. And they're back now to the regular rate?
Yes, yeah.
Were they part of the Appendix K?
No, the Appendix K is specific to services for adults with intellectual and developmental disabilities.
Okay, so that increased rate, where did those funds come from?
So it's like all rates, a mix of state and federal funding. And I'd have to do some more legwork to tell you exactly where the state funds came from, but they qualify for a significant federal match through the disaster SPA.
Okay, and we had an increase FMAP of 6.5%, right?
Yes, yep.
Okay, is that where this increased rate came from, that increased FMAP, or was it more general funds as well? Are you aware, do you know?
In order to give you a totally accurate response, I'll have to get back to you, but I'm sure the increased FMAP would help with the amount that we were matched by the federal government for sure.
Yeah. Okay. Any questions about the first page from anybody? All right, let's turn to the second page.
And then a note there too for the sections 18, 19, 20, 21, and 29. Those are all those temporary rate increases, as I noted, are on those two additional sheets that I sent. So that's why they're not in here. The next is PNMI Appendix Ds. Those are children's residential care services. And these, again, show both the regular rate and the temporary and the increase that those facilities received. And
yes, Representative Perry.
Okay, I'm looking at page 2.
Yep.
And bear with me for a moment. At the bottom of page 2, I'm looking at behavioral health services, and it looks like that this is a 2-month rate going through August, July and August.
So you're a little bit ahead of me. The payment supports for targeted behavioral health services, yes, right, are additional. These are rate increases, temporary rate increases that the department has moved forward on to support these specific services. So those are going to be increased through July and August.
Okay, thank you.
Yes, yeah. But the rates above in PNMI Appendix Ds, at first, there was a temporary rate increase for all of those at $54.45 a day additional above the normal room and board, funded by OCFS rather than Maine Care. And then the rates in the table there apply to children's PNMIs who are experiencing an open outbreak. So we do have increased rates here for those who are experiencing outbreaks to help meet the needs that they're facing. All right. And then as Representative Perry noted, the supports here for targeted behavioral health services, including school-based and children's behavioral health services, adult skills, and community support. These are temporary increases through the months of July and August. And these are providers who did not receive a temporary rate increase earlier this spring. And so this is this table lists the rate that they will receive through July and August. All right.
I'm just going to take a second break here because there's a new person who popped in, Roy Lopez. Can you identify yourself, please?
He's from IT.
Yes, I'm from IT.
Okay, thank you.
Sorry.
Okay.
IT. So at the top of the third page, we just have a quick note to let you know about a non-rate special payment that went to hospitals toward the beginning. Yes, I can absolutely share my screen, Senator Bellows. Let me do that. Here. All right. Can everybody see my screen?
Mm-hmm.
Yes. Okay. Great. So the, as I noted up here, we have special hospital payment that was $10 million in supplemental payments to Maine hospitals sent out through Maine Care at the beginning of the pandemic to support them in a lot of the changes and loss of services that they needed to grapple with. All right. So the next section is early implementation of rate increases from budget initiatives. So all of the rate increases that you, or the majority of the rate increases that you approved in the supplemental budget were live, scheduled to be live July 1st, the start of the new fiscal year. But with some funding in Maine Care and due to the pandemic and the challenges a lot of these providers were seeing, the administration identified funding to start those rates a little early. The dates are a little different based on where we were in the rate study and methodology and work that we needed to do on these. But for the first two Section 65 rate increases. So these are medication management and children's home and community-based treatment. Those rate increases were able to be effective April 1st. And this shows you the old rate and the new rate for those two services or sections of services. And then the next section, just specifically for Representative Madigan, is multisystemic therapy and family functional therapy. Those rate increases we were able to make effective May 1st. So you can see right there the old rate and the new rate. In addition to a rate increase, they also changed the way that these rates are billed. So rather than going by the quarter hour, it is a per week rate, which helps understand some of the large jump there, but it was a sizable increase for these services after we completed the rate study. All right. And this next section is the section that is, I think, most relevant to the bill that you are looking at right now. These are the personal support services, sections 12, 19, 96, and then as well as some of the state funded portions of these. And these will run you through all of the rates, the old rate and the new rate for these services per the appropriation in the supplemental budget. So this first section is section 96, which is private duty nursing and personal care services.
Can I just interrupt you for a minute?
Sure.
Representative Craven?
Thank you, Madam Chair. I'm going back to the multi-systemic functioning. And is the new rate permanent? The weekly, and it's going to stay that way?
Yes.
Is the department looking at doing that for any of the other services as opposed to constantly just reimbursing for every quarter hour?
I do think that there is some work. It really depends on the service, and I'm more than happy to look into specific services. I know that there is a number of services that Maine Care is working with the Office of Behavioral Health and Office of Child and Family Services to see if there are ways that we can better provide these services and support providers. You know, we've done a good amount of work looking into value-based payments, which often are those more the sort of like the per week rate rather than the 15-minute rate. And so there is work happening there. If you have a specific service, I'm more than happy to get you information about that.
That would be great. It's such labor intensive work for the staff that they need extra staff just to calculate that. Thanks.
Yeah, we've heard that from a number of providers and are taking it into consideration.
Okay. Yeah.
So as I noted, section 96, the private duty nursing and personal care services are this first section. There are a number of rates here. And then we have section 12, which is consumer directed attendance services, and section 19, which is home and community benefits for the elderly and adults with disabilities.
Okay.
Great. And then the other rate increases that were in the supplemental budget are listed here. Those are sections 18 and 20, which are respectively home and community-based services for adults with brain injury and home and community-based services for adults with other related conditions, which are usually complex medical situations. So you'll see the old rates and the new rates there. And then there are additional rate increases on a small selection of section 21 and 29 services that are going to be in effect January 1st, 2021, due to the waiver renewal work that we are doing with the Center for Medicare and Medicaid Services.
Okay. And then we're back to the Appendix K.
Yeah, and then on the two additional sheets that I sent, the first is May 13th, although I realize that may only be in the title of the file, not on the sheet, so I apologize. The top of this sheet says Appendix K rate increases for sections 19 and 20. So this will run you through the percent change and the rate and the unit of that rate for each code in each section. And then we'll see the codes for section 20 below here. And these are effective 30 days following the end of the emergency or February 28th, 2021, whichever is sooner. And those are shared living rates.
Yes, Representative Perry.
Okay, I'm where you are, so I'm not going ahead here. The shared living services. It says these are new services. Are these new services that were planned? But it looks like this is still as a part of the emergency. So I guess my question is, was this ever paid? Or is this an increase? Or is this just an initial start that's going to go on?
So I think by new services, this means a new way of paying for this service. So I will get more information from ODES on this, but we have always reimbursed for shared living with one member. We have reimbursed for shared living with two members, but at essentially half the rate. And so if a provider or family has two shared living clients in their house, they are essentially paid the same as having one shared living client, which has been, I think, a large barrier to having shared living providers with two clients. So this is work that the department has been doing, and the Office of Aging and Disability Services has been leading to make sure that we can find a better way to provide for shared living services that have two clients, because there are a number of people for a number of reasons who want to live in a setting where there are two clients. So this, I think, has to do with that transition that we are making to billing for those. We have shared living is not a new service, but I believe this is a new way of providing these services, and can get some more information from the Office of Aging and Disability Services on that.
Okay, then I'm looking at this, and this is what I'm trying to figure out. The section S5140 for one member that has increased level of service is 249, and yet section 20, shared living with two members served with increased level of support, is less.
I think that's per person though.
Oh, per person. Okay.
Yeah.
Thank you.
Yeah, no problem. There's a reason I don't often come to you with tables of main care codes. So we'll get through it together.
Are there any other questions? I'm scrolling through because I have Molly's information here, and then I have to scroll through to see if anyone has a question. So if I'm not finding you, I don't see that there are any questions right now.
Okay. Then I'll move to the last sheet that I've given folks, and that's Appendix K, Section 18, 21, and 29, temporary rate increases. And again, that lists in the same format as the last sheet. The procedure codes, the waiver section, the amount of the change, the rate, as well as the unit that is billed.
So since some of these codes have gone, the increases have gone away, what are you hearing from the providers?
Yeah, the Office of Aging and Disability Services has town hall meetings on a regular basis, and I apologize, I didn't think to check in with them specifically about what they've heard recently from providers. I know, a lot of these providers are in the same challenging situation that a lot of providers of these services are. And so we certainly heard pushback when those temporary rate increases ended, although it was a financial decision and a timing decision that the administration felt we needed to make. but there's, a lot of other work that is happening between the department and these providers, especially when they are facing outbreaks. There's support that comes from the Office of Aging and Disability Services, as well as the CDC, and the Division of Licensing and Certification has also worked with the CDC and ODES to do a survey of each facility to make sure that they have proper infection protocols, as well as the information and materials that they need to take care of clients in this time.
So we don't, if we were to ask, and I don't think there's anyone in the chat room who's a direct provider, but can you tell us a little bit about, you have mentioned it, about how you keep up with conversations, or how accessible the department has been to conversations with service providers so that you understand what it is that's happening with them?
Sure. And I'm going to stop sharing my screen just so we're all in a bit more of a mode that's conducive to conversation. But let me know if you'd like me to put that back up. Starting early in the pandemic, right in March and early April, the department across our offices stood up a number of recurring meetings with providers as well as stakeholders to make sure that we both had an opportunity to communicate with them updates about the pandemic, as well as the work that we've been doing to provide supports, and hear directly from them, both providers and, as I said, consumers and stakeholders and families about what their needs were on the ground. And so I know ODES has held weekly stakeholder meetings, as well as specific, one-off meetings on specific items with Maine Association of Community Service Providers, or MACSP, and other groups that have a vested interest in this work, to make sure that we are hearing from them about what their needs are, and that they're hearing from us about our capacity to meet their needs, because as we've seen in a number of areas in this pandemic, the capacity that we have to meet the needs of everyone can be limited sometimes. And so we've tried to have that communication open. As far as weekly meetings, we've also been meeting with hospital groups, with the Maine Healthcare Association, the Maine Primary Care Association, the FQHCs, children's and adult behavioral health town halls have been held. I think they're moving to monthly now, but they have been held weekly. And so we've stood up a lot of those recurring forums to make sure that we're reaching both the providers, but also other stakeholders of these services, and hearing what they need.
Thank you. You might not be able to address this, but if you can, let me know about the rate increase, the rate study that's going on slowly but surely through the department. Can you tell us where we are with that?
Yeah, so we did award a contract to, I believe, Myers and Stouffer to do that work, the rational or the rate setting system analysis that used to roll right off my tongue before the pandemic, but we'll get there again, I'm sure. So that contract has been awarded, and they are working with Maine Care. I think, as with a lot of things, it's been a little bit delayed, but we are plugging right ahead on that and anticipate having a report sometime next year.
Okay. So you feel like things are moving along despite the COVID response, things are still moving along with rate setting conversations? And
yeah, a little bit more slowly, but moving along for sure.
I think our expectation is the beginning of next session, we have a report back from what's been happening through November. And I think in November, we get some kind of something or other report back, if I remember right. Okay. Questions for Molly? Representative Craven.
Thank you, Madam Chair. So we're all worried about the economy, obviously. I guess I wonder, as you're setting up the rate setting, how you're managing to determine rate setting with the expected downturn in the economy?
Yeah, so I'll have to ask Maine Care what exactly they're doing to work with Myers and Stoker around that. I think just broadly what this project is doing is going to benchmark us to a number of other states' Medicaid rates, Medicare rates, and private rates. And so what it'll do is give us a picture of where we are in the landscape in similar states, states with similar economic and other contexts, but give us a sense of where we are comparatively. And so it's not going to make recommendations about what the rates should be. That will be the next step that will come. So I think it will be less impacted than that rate setting conversation, but then by the economy. But I'm more than happy to check with Director Probert about the way
It's just
that
a
is.
worry if
Yeah.
if we set rates when the economy is really bad and it's not adequate to do the work, and you have to start with the whole process again once once the economy improves.
Yeah, I think that's absolutely something we should have in mind, and we'll be happy to share that.
Well, the chairs are chatting though. I might as well use the time. I have heard, and our whole delegation from Central Maine has heard from providers that they are struggling. They're struggling for the PPE as well as being able to afford quarantine and those kinds of extra services. And so, and I, it just is a little bit different conversation when we're talking to the providers. Okay, I'm back. Somehow I keep losing this. Does it come back out and back? Okay, but then it comes back in. I think it's I think it is the video. So if well, then you're too close to each other. So I think just if some of us take away the video, that would be good. If that happens, it means too many videos are on. Yes, Senator Claxton.
Thank you, Madam Chair. Looking at the bill itself, I'm puzzled a little bit by the language. It says the department shall raise the hourly reimbursement rate by 40% without referencing what it's raising it from. Are those 2018 numbers or those 2019 plus or 2020 plus interim numbers? So I think in the future, we need to be really careful about how we couch that and specifically reference a set point from which changes are made.
Luke must have
Because
made
we're going
some.
to have this conversation again.
Yeah, so there must have been some assumptions made for, I think it's the fiscal year, whatever the number was for the fiscal year. That's where the number was taken from.
So it'll be as of January 1st to the start of the fiscal year.
Yes.
Okay, thank you.
Okay. Any other questions? Senator Bratwick. All right, so I have a move to table on the second. It's non-debatable. All in favor of tabling? Looks to be unanimous. Motion carries. All right. All right, we're now going to move to LD 2117. Senator Gratwick will take this one.
Thank you. For 21. Excuse me, I'll turn on my mic. 2117 is the bill we first heard in February, March. And this is a part of a long-standing effort to make the prescription monitoring program more effective and more efficient. This is a bill that we would ordinarily have worked in great detail. There is now a proposal, and I'm going to turn to Gordon Smith, who is the opioid manager. I'm going to turn to him how we would restrict this to a very small part of it, only section of 14 of the bill. We do not have a written amendment to this extent, but the question for the committee is going to be, should we go with the whole bill? And people can have their own opinions about that. Should we go with a very small part, which is just section 14 of the bill, which I'll let Gordon explain to us, or should we have this as a bill that we're going to come back to? So is Gordon Smith?
I'm here, Senator Gratwick.
Good, good.
I'm going to
Gordon,
assume.
would you be kind enough to introduce yourself, and thank you for wearing a necktie in this formal situation and knowing where you
Yes,
are.
well, I checked with my fashion advisor, Dr. Gratwick, and was informed that this would be appropriate. 44 years of testifying for the legislature, and this is my first virtual presentation. So thank you for the opportunity, and really glad to have a short time with you today. I'm really here to deliver kind of a message with respect to 2117 on behalf of the administration, that we are no longer seeking any passage of any of this bill, except we'd like to have you take a look at section 14, which is a very narrow amendment that was really corrects, frankly, an oversight in the legislation that passed 3 years ago that allows hospital medical officers, chief medical officers, to access prescriber profiles in the PMP for their employed clinicians. When that was done, we should have, in my opinion, included chief medical officers of medical practices like Intermed, like Martins Point, and federally qualified health centers, which all of you are very well familiar with. And it was an oversight, and when that was brought to our attention, we put it in this bill to correct it. That is not central to the major portion of this bill, was to expand the PMP to include non-controlled substances. We are not ready to do that. The work that needed to be done to do that back in March, April, May was not done. We are not seeking that change at this point in time. You'll recall that is something that's been done in Nebraska, and it's talked about around the country, but we are not ready to do that. I can tell you that the transition to a new vendor at the PMP and the work under the federal law and the federal funding is being done, and that vendor changes as of October 1st, actually July 15th for pharmacies. So again, we're just trying now to correct, to expand, if you will, access so that a chief medical officer who has some legal liability for the prescribing of their employed clinicians can access the PMP prescriber profiles. It would entail passing just section 14 and 2 of the definitions in section 4. The definition of a federally qualified health center, which is drawn from other state statutes, and the definition of the of medical practice, section 3A. I'm happy to answer any questions. Again, I really appreciate the invitation, and hope to be physically with you at some point in the future. So that's all I've got to to add at this point. I'm happy to answer any questions. And it's a fairly narrow ask that we have before you today.
Thank Mr. Smith. Thank you very much. And just to clarify for me, right now in a private practice, does the CEO have this right at this time? Is there somebody in a private practice that has this right, or nobody?
No,
in the private practice?
No,
Nobody.
the way it's handled now is that the employed clinician could be asked to do a self-query and get their profile and present that to their supervisor. That's not very efficient when you're if you've got 70 or 80 prescribing clinicians that you're responsible for. But it's only the prescriber right now that can get his or her own prescribing profile in the PMP. Except, yeah.
If someone works, if I work for a larger institution, I work for Northern Light or Maine Medical, the CEO, my understanding is there, can get this information.
The CMO of those institutions. That was a bill that was brought in by the Hospital Association about 3 years ago that passed. And again, we should have, in my opinion, it should have been broadened at that time. If anybody missed that, it's probably my responsibility as the director of the Maine Medical Association at that time. Hopefully the statute of limitations is closed on that. And but now you have a chance to correct that omission.
I see, but I will refrain from further remarks on that one, the score. But so for the committee members, so this is a prerogative that larger hospital systems, public hospital systems already have with their chief medical officer, and the private or medical operations do not have. Thank you. And then a brief question for our two analysts, and then we'll go to questions from the committee. This has not been prepared as an amendment at this time. And so if we vote for this to go through, then you will prepare an amendment that we then would see next Wednesday?
Honestly, Senator Gratwick, all you would be doing is crossing out almost all of the sections of the bill. You would need to keep 4 and 6 because they're the definitions, and 14, which is the substance, and everything else just gets crossed out. So you would get a new fiscal note, but it will look just like the old fiscal note because there's no actual cost to this, but it still has to go through the motions. But we can certainly bring that back for you, but I can tell you right now that's what it would look like. It would just strike out all of the sections except for 4, 6, and 14.
Questions from the committee, starting off with Senator Dr. Claxton.
Thank you, Senator Dr. So, and as long as we're talking about it, we'd also have to change the title because this really represents an expansion of existing statutes.
Yes, you would change the title. You're correct.
Thank you.
Thank you. Are there other questions looking around for hands there? Other insightful, prescient, difficult questions for Mr. Smith? Mr. Smith, what are the reasons not to do this? Argue against yourself, please.
Well, it's a pretty, I can't think of a single reason not to do it. It equalizes the situation between the large hospitals, which certainly employ most of the clinicians, and those private practices and federally qualified health centers that also do a lot of the prescribing of opioids in the state. And it will in some small way help us with respect to, the overprescribing of opioids. That is no longer really the driving force behind overdoses in the state, but there is still some overprescribing. You've got, thousands of prescribers, and the PMP is our best tool, arguably, along with main care data, to work in an educational mode to make sure that people are not putting more opioids out than they should. Now, I grant you, since 2016, opioid prescribing for pain has decreased by about 50% in the state. So again, that law has been very effective that this committee passed, your predecessor, and but again, it's still, the PMP is an important resource and it's an important tool, and in those practices that are not owned by hospitals, they, in my opinion, need this tool to help them oversee, supervise appropriate prescribing for pain in those practices.
Thank you very much. Representative Hymanson?
Yeah, just because we've opened up
questions.
this conversation and we have you here, Gordon, could you talk just briefly about what's happening with opiate related deaths and the opiate problem in general? As we've gone through COVID and the numbers, I know the deaths have continued to stay the same or go up. Can you address what you think may be the cause of that and what you're seeing in the landscape through this challenge of COVID?
Sure. Many states in New England and us have seen an increase in overdose fatalities, which is alarming, disappointing, but it's a complicated matter because those increases in many places, including Maine, were seen before COVID-19. Our increases started about last fall and continued, and now probably have been exacerbated by the stay-at-home restrictions. We don't really probably need to take the time. You all are well aware of the dangers out there when addiction is a disease of isolation, and we spend all kinds of time supporting people in recovery, connecting them to people and resources. When you ask people then to stay home, to say nothing of the dangers then to people who are experiencing homelessness, it's a very difficult period. There was an article in the Washington Post last week that I'd be happy to share with your staff that I think said maybe 35 states have seen increases. I was on 2 calls last week with others in New England. The increases in Connecticut and Rhode Island have been very much like ours. I can't give you exact numbers because Attorney General Fry is going to next week release the numbers for the first 5 months of this year. Those numbers, as you know, come from the Chief Medical Examiner's Office. Research is done by Dr. Sorg and her team at the University of Maine, and Aaron is going to be releasing those next week. Then we have our opioid summit that you've all been invited to virtually the next week, and that will give both Aaron and the governor and all of us an opportunity to say what we think some of the responses should be to it. So it's heartbreaking. It was predictable. The post-COVID piece was predictable. I think we've got to get a lot more data and research into why we started seeing this last fall. The real cause is the safety of the drug supply. In other words, it's all so much is laced with fentanyl. Even if you use a fentanyl test strip, it doesn't tell you how much fentanyl is in the product, and people do not know what they're using. And
can I ask just a question? So that if the deaths increase, it doesn't necessarily mean that the use has increased, because fentanyl could be killing everyone with polysubstances. So do you have a sense that the use is also increasing?
I don't have enough information. We have good people now at the Office of Behavioral Health. There's 2 new deputy directors, and we now look at the data on overdoses, not just fatal, but actual, non-fatal overdoses. We've had,
Okay. Well, I think I just wanted to sort of plow into this a little bit. It's not really germane to this bill, but
Right.
but I look forward to the opiate summit, and I hope people out there, if you're interested, look into that because it is virtual now, so it opens up possibilities for people to come in. But thank you very much.
So, excuse me, other questions for other members of the committee? If you're on visual, I can see you. If you're on phone, I can't see you. But seeing no others, I would, keeping up with our pattern, I would ask for a motion to table. A motion from Senator Representative Hyman.
I'll make a motion to table.
Seconded.
Second.
Seconded by, so we
Second.
have tabled this, and that brings to an end.
We need a vote.
No, we're not. What?
We
You
need a
want
vote for the tabling motion.
Oh, I'm sorry. All in favor of tabling? Unanimous? Thank you.
Wait, hold on. Call the vote again
All in favor?
of the tabling motion.
Okay, it's not unanimous. Oh, yes, it is unanimous.
Representative Stover, I think
Yes.
it's stuck, that's all.
She's stuck with her hand
We
up.
need a quorum. We need at least, you need to see,
Yes,
you saw it?
yes, I did.
Okay, all right.
So, tabled. So now, with apologies, just a 1 minute at ease while I talk with Representative Hymanson, and then we're going to meet with our caucuses. So,
Thank you. I'm signing off. It's nice to see you all. Molly, when you get back into public session, Molly will be available if you need anything, but I think you're pretty much done with me. So thank you. We'll see you all soon enough, I hope.
at this time, we're going to take a 5-minute break, and we're going to meet then as a Democratic caucus up on the 3rd floor balcony, and we're working for the Republican caucus with Representative Griffin, which Nick and Anthony will be arranging shortly. So we will then have our caucus, we'll have our brief break, our caucus, and then we'll return here to have votes with Allison. And then after that, we'll take up the amendments. Questions? Thank you. Testing one, yes, this is good.
Jeff, sorry I didn't take your call.
Sorry, Mary, we were going to have a brief meeting of chairs and leads, but we've gotten now, so Abby said you had a good conversation, so we're ready to have our votes.
Yes, we did. And your caller ID comes up as Jeff Quimby. So I didn't answer the call.
I see. I'm married and I do what I'm told.
Oh. Allison, it's so good to see you.
It's good to see you too.
Hello, Senator Moore.
But we
How are you
can't
doing?
see her.
Doing good.
I don't know if we're still on YouTube or not, but it's good to see everybody.
Yep. Except we don't see your video.
Well, I'm trying to save bandwidth.
Ah.
My ribs have healed since I'm not sitting next to Beth any longer.
You like it. I know you do.
It is good to see people.
All right, so we're almost all gathered. Our plan right now is to gather in AFA. And we're missing one person who should be coming on her way. Do you see her on her way? Oh, great. Oh, good. All right. Yay. All right, so we have, just as a reminder, we have 9 people, 9 committee members in the room. And we have 3 who are in Zoom format. So I'm proud to
Representative
say-
Madigan, Representative Hymanson, excuse me, sorry. Have you checked the waiting room for Representative Talbot Ross? I think she should be available now to participate remotely.
Thank you, but we're still going to vote. We're not going to go through all the agenda again. We're going to vote.
Yeah.
Voting is coming up. She's welcome, but we're going to vote.
Yeah, I don't see her. I don't see her on here. Oh, is there a waiting room that you see?
I
No,
can't
that's
see the waiting
IT.
room, but she communicated with me that she would click the link just 5 minutes ago or so. So I wondered if she might be waiting to be led into the meeting.
Senator Gratwick, is there a functionality for you to turn on for a waiting room?
Sorry, Nick is the person who has to turn that on.
The waiting room is on. There's nobody in it at the moment.
Okay.
Okay. All right. There's no one in the waiting room. We understand it.
Thank you. So we're proceeding ahead.
Yeah. So, so we are all assembled, and I'm proud to say that we have nearly everyone from the committee. So I wanted to just spend a minute and say thank you to the committee for showing up and being present. And this is such a tough format and a tough time. And it's really taken so much work to get us to this moment. So thank you also to the staff of the State House for making this happen. And I could list names, but there would be too numerous to count. Too many of them. So just a general thank you to everyone who made this meeting possible, getting us here. And I'm going to expand the thank you to people from my district and the whole state of Maine, because they're the ones who count on us to do this valuable work. So saying that, I just lost the Zoom connection. But that might be because of the video. So I'm just going to stop my video. So Senator Gratwick, did you want to take it away?
Thank you. So we now have, we have to bring the first one off the table, of that being 2135. Could I turn to someone to bring this off the table?
I make a motion to take 2135 off the table.
Yes, thank you.
And the second?
And seconded, okay. Motion off, so we have a bill in front of us.
So I'd like to make a motion.
With a word change. And is there a motion? Who would like to make a motion? Yes, Representative Perry?
I make a motion ought not to pass.
Thank you. Is it seconded?
Second.
Seconded by Representative Craven. Any further discussion?
I think we talked about this
Seeing
enough.
none?
Well, I think we talked about
There
this
is
enough,
further
but just adding new language to old language just didn't seem to elevate this in any way. And so, but I appreciate hearing from the AG's office and knowing that they're a resource for any business that's out there that has some confusion about it. That would be the place to go, to the AG's office, to talk to them about the law itself and interpreting it, or talk to your state representative or your state senator about it.
So then, any further comments on 2135? I'm going to ask people to raise their hand, all in favor. Ought to pass. Raise your
Ought
hand.
not to pass.
Have we made that motion? Yes, I'm sorry. Ought not to pass. All in favor of the ought not to pass, raise your hands. Keep your hands up so that Allison can do a roll call, please.
Those voting in favor of the motion: Representative Meyer, Representative Stover, Representative Perry, Senator Claxton, Senator Gratwick, Representative Hymanson, Representative Craven, Representative Madigan, and Representative Griffin.
Thank you very much.
And just as a reminder, the joint rules say that voting can, for this type of motion, has to stay in we all have to be assembled. And so the people who are not here and are on Zoom can have two ways of voting. One is to physically record your vote in LIO within 24 hours. The other is to call the presiding officer and have your vote recorded there.
Thank you. 9 ought not to pass with other votes pending. The second is 2137, and this is, we've heard about in some detail, and we need a motion to take this off the table. Claxton, Craven, it's off the table. We need a motion one way or the other. Ought to pass, ought not to pass. Yes, Representative Craven.
Thank you, Mr. Chair. I move that we ought to pass as amended.
Second.
Ought to pass, seconded. Are there comments that people wish to make on this before we take the vote? Yes, Representative Perry.
Well, I would like to make a comment. I think getting these raises are important. The concern that I have is the description of the increases, 40% and 53.5%, are really out of any range that could be done. And much as I want to pass this as a policy statement, I just have concerns about how that is worded. And maybe we could say up to instead of definitively of, and give some room to work.
Thank you very much. Yes, Representative Madigan, and then Craven, and then
I support the bill. I have some concerns about the costs associated with it. But I think in general, making sure that people who provide services for some of our most vulnerable in their homes is really important. I would like to see kind of us making sure that that rate increase actually goes towards the hourly wage of some of these workers and not just towards administrative costs. I understand it's difficult to run programs and things like that, but I think some of the folks who provide these services are some of the lowest paid people out there. So.
thank you very much. Representative Craven, then I'm going to look for people who are on the Zoom.
Thank you, Mr. Chair. I would also agree that the bill needs more work, but I would like to give appropriations a vehicle to be able to do something with raises for frontline workers, and that the small raises they got for the COVID-19 has ended, and that we need to do some work in that area. Thank you.
Thank you very much. Representative Hymanson, and then
Yeah,
I'm looking for anybody.
I'm going to support this bill purely as a fiscal note, because I think the way that it's worded in the policy really is not our intention. And I'm going to speak that to appropriations myself as a side, because so much has happened between when this bill was put forward and now that I can barely keep track of that. And I don't think there's a good accounting of and I don't think we can even make a good accounting of it. But I do know that direct care workers need more than they're getting. And in order to give them a vehicle to make that work, I'm willing to say yes to this, as sloppy as it is, to put some money on the table so that can be a help to direct care workers in this territory who need the help so desperately.
Thank you very much, Representative Hymanson. Can people hear me?
Yes.
Yes. Okay, good. Anybody online? Senator Moore or Representative Javner, any further comments on this?
Yes.
Yes.
Yes, so I am in agreement with this. For quite a few years, we've been trying to get funding to increase the benefits for these individuals. I am very concerned about the huge fiscal notes that are on it, as with what Rep. Perry said, that it could be up to, but I do believe that will be in the hands of the Appropriations Committee, and I will personally talk to my members about that, because I think it is important that these people get the money that they need to be able to operate properly and to actually pay their bills.
Representative O'Connor, thank you very much. Well said.
And I agree. I agree with what Representative O'Connor stated.
Thank you.
I'm sorry, can I just ask a quick question? You didn't say what the amendment is, but I'm assuming that your ought to pass as amended is just the fiscal note. Is that right? Are you making any other changes to the language?
No.
That's correct. Any further comments? Then just for me, I concur with what was said. A very important message for a very important group of people in our society. Any further comments? All in favor of the motion, which is ought to pass as amended? Hands up. Allison, I'll call the roll.
Those voting in favor: Representative Meyer, Representative Stover, Representative Perry, Senator Claxton, Senator Gratwick, Representative Hymanson, Representative Craven, Representative Madigan, Representative Griffin.
Thank you. Unanimous of those present. And finally, our third work session 2117. This has to do with that section 14 of the prescription monitoring program. Is there a motion to take this off the table, please?
So
Representative
moved.
Fagan? Moved and seconded. Is there a motion what to do with this bill? Representative Perry?
I move ought not to pass.
Thank you. Moved and seconded. Further discussion? Representative Hymanson?
I understand what Mr. Smith, Gordon Smith, was talking about with that very small piece, but I think that needs to have its own public hearing, and we're coming up to the 130th anyway, so we can choose to make that into another bill. So I support the ought not to pass motion as well.
Thank you. Senator Claxton?
Yeah, I think that piece that Gordon had asked for makes a lot of sense, but it should be its own standalone piece of legislation.
Thank you very much. Other further comments? Seeing none online. Any comments online? So there's a motion on the floor, ought not to pass. All in favor of the current motion, please raise your hands and keep them raised.
Those in favor, Representative Meyer, Representative Stover, Representative Perry, Senator Claxton, Senator Gratwick, Representative Hymanson, Representative Craven, Representative Madigan, Representative Franklin.
Thank you. Thank you very much. So ought not to pass, unanimous of those present here. The others will follow suit. Welcome, Representative Rachel Talbot Ross. So now we will turn to the amendment reviews. I think we have 9 there. And so I'm going to turn this over to Anna, starting off with 1142.
Yes, I'm here. I believe you were waiting for Representative Maxman to come in.
I just communicated to her that you were taking up her bill now.
Do you want me to start while or do you want to wait for her?
So let's, are we waiting for Representative Maxman? I must admit I wasn't aware of that at this time. But while you're trying to get her on the phone, let's then go ahead to 1482. And then we'll circle back to
1482. What? 1482?
Yeah, that's not the right number. I don't know what number you really mean.
I'm 1418. I'm sorry.
Oh, okay.
I missed my one.
So we're not taking the bills in the order that they're on the agenda.
Yes, 1418. Oh, I'm sorry. Let me back up. We're taking just the ones, fairly straightforward bills that have amendment review or fiscal notes, and we have 7 therefore left over for next Wednesday. So we are not doing 803. We are not doing 1134.
No, I understand that, Jeff. I'm talking about.
But we have a list on this agenda.
That's what I was referring to as the list.
And I think that's what we're going to be using.
Oh, I'm sorry. I was going in our original numerical order. I don't have.
Do you have this? Do you want that? Okay.
So I do understand, not to interrupt too much, but I believe that Representative Maxman just joined the meeting.
Okay, so why don't we start with that bill, which is.
Okay, therefore we're starting with 1142. Erin, is that correct?
Yes.
Yes. So can you see did I successfully manage to share my screen here?
Yes.
Is everybody looking at this? And you have it in your folders as well. So this is the bill that's about individuals who have services in their plan of care that are not medical, but the person requires transportation to get to those services, and those are not currently covered. So both amendments, both the majority and the minority, have the same section 1, which you can see on the screen here. And this is requiring the department to review non-medical transportation programs in other states for services in the plan of care. You heard that there was one in New York, so that has been cited in here as well. And the department would assess options and then report to the committee. So that is in both of these amendments. And you can see there that I have circled the date. That this requires the department to submit a report that would come back in January of next year. And I didn't know whether you might want to change that or not, whether you think that's coming up too soon, given that if you move forward with this and it were to be enacted, it wouldn't go into effect until 90 days after whatever the adjournment date might be. So that's something to think about. And then I'm just going to move on to the second piece as well. And you can see this is the fiscal note for this section, that any additional costs for the department are expected to be minor and can be absorbed within existing budgeted resources. And then the minority report has the same section 1, and then the section 2 requires the department to establish a pilot project that would allow for $1,000 for an 18-month per person for transportation services that are in addition to the medical piece. So because we know there's the non-emergency medical transportation, so it's putting that aside. And then report to you as to what, how that went, whether it worked, how much it would cost, all that kind of thing, its viability. And once again, this, I don't know whether the date needs to be changed, but it's something for you to think about. And I was also, I just want to go through the fiscal note really quickly as well. This is the fiscal note, and you can see I put on the bottom that there are, this is straight from Luke, of course, not from me. There are currently 2,148 members in the Section 19 waiver. 60% of them have no transportation. They assume an 80% utilization rate. So this fiscal note is based on 1,289 members using $1,000 over an 18-month period, which is why it's spread over a couple of years. So this he has assumed for the fiscal note a start date of November the 1st. That's just sort of based loosely on 90 days after adjournment if you were meeting in August, you know, because he has to base it on something. And I think that you also do have a copy of the vote sheet in there. This was, the minority report was Representative Craven and Representative Madigan. This was a 9-2 report with 2 members that were absent. So that's what I have for you. So you may want to reconsider, or at least consider these dates and decide whether they should be changed. I do just want to make sure that if you do decide that they should be changed, to keep in mind the legislative calendar. These are reports to the committee. So no matter what you decide to do, they need to come in a time that you can do something with them. And the second piece is the 18-month. You've got to, is that enough time for establishing a program, going through its 18-month period, and then assessment. So I don't know whether that needs to be changed or not. I'm pretty sure that the first one may well need to be, or not. Your choice.
So just to so that I can clarify, so that the majority report, which is 9, minority 2, majority, which we have the amendment for, we would need to change the date, which is currently January 30th, 2021, and I would have people think about what an appropriate date for that is. And then the minority report, I'll leave it up to the people who signed on to that to discuss what they want further. Representative Craven.
Thank you, Mr. Chair. This is a bill that I really support, especially in the condition that and the conditions that we're working under, where public transportation is reduced and opportunities for public transportation. I did speak to some of my colleagues, and somebody on the prevailing side, Representative Myers, is willing to open this up for a new vote, and would like to address that. And also the sponsor is on the phone, and she, I think, would like to address
okay
parts of the bill.
Thank you. Representative Meyer?
Thank you, Mr. Chair. So that is correct. I am on the prevailing side of this, and so I'd like to make a motion to reconsider.
Thank you. Seconded? Anybody? Representative Stover, seconded? Yes. Further discussion? Yes, you're correct. I'm wrong. All in favor of reconsidering? Unanimous of those present? I can't see everybody else. Sorry.
It wasn't unanimous, but I will make it unanimous.
Thank you. So further remarks,
Yep.
Representative Meyer.
So I will allow my colleagues from Lewiston and Waterville on the minority report to make their case.
Well, this is a pretty innocuous bill, really. It's a resolve to have the department create a pilot project for non-medical transportation for people. And I understand the majority report wanted to take a look at outside resources, but I think that this is services similar to this have been present in the state of Maine before, and that was very, very workable. This is just a few people, over 2,000 people who are senior citizens and who get Section 19 services. And, if we are going to look at the social determinants of health in our society, people have to eat and people have to really get to places like the farmer's market or other places where you can get healthy food. And or even go to church. It's really very, I think, difficult to be healthy if you don't have transportation to take you where you need to go. I would really like to hear from the sponsor, if that's okay.
Thank you very much. It was next to Representative Madigan, and then Hymanson, and then the sponsor.
I would just ask for people to support the minority report, because it really just asks us to have a pilot project addressing real problems for rural transportation. Well, it's more acute in rural areas, but it's also present for the constituents I represent. It used to be that some of the CAP agencies ran buses, and they still do, but there's more limited service. And people, particularly in the time of this COVID-19 pandemic, they still need to get out and do their groceries. It may be more difficult for them to get the home-based services they need, whether that means home care workers coming to their house, caseworkers, things like that. They're more isolated. Starting a program like this, kind of doing this pilot project, allows us to have some of our folks that are not able to afford a car or drive the chance to get to things like the grocery store, other places in our doctor's offices. Once the pandemic passes, it can help people be more integrated in their community. And that's the kind of thing that can really help people stay in their homes. And I think it's a real value, particularly in those areas outside of our major urban centers.
Thank you very much. Representative Hymanson, and then the sponsor.
Yeah, I'll just say I'm at a bit of a disadvantage. This folder didn't come up for me, so I don't have it. So I'm just I'm running on my memory, which is that both of the minority and the majority report were ought to pass. So I think we all agreed in that vote that this is important. The issue was whether there was a pilot program out there that seemed successful and needed to be started right away with funds to fund a pilot project, which would go into a fiscal note, or whether we were having a resolve that would ask the department to look at the available programs in the United States, choose something and give us a report back so we could hear about them and decide which one was going to fit the need for the state of Maine. Because there were a number that were successful and a number that were not successful. And so what I see, if we do, if the, what I'm saying is I'm going to stick with my vote to ask the department in a resolve to look at the possibilities. I also feel that we're not going to have any money to spend on this. So there, in my crystal ball, there will not be money to start a pilot project. But I think a resolve that where we ask the department to do some exploration work that doesn't have a fiscal note to it probably would move the discussion along so that we can hear what the possibilities are when a day comes when there might be money again available to start a pilot project. So for those reasons, I'm going to stick with my original vote.
Thank you very much. Representative Maxim, and then if people would just raise their hands if they want to speak as well. Representative Maxim, welcome. Should you introduce yourself just briefly? You have to unmute yourself. Representative Maxim, to unmute yourself.
Yes, I did. Can you hear me okay?
Yes, thank you.
Great, thank you. My name is Chloe Maxman. I represent District 88, Chelsea, Whitefield, Jefferson, and half of Nobleboro. I've been working outside all this morning, so I apologize for my disheveled appearance. I'm grateful for you all considering this bill again. There are a few things that I want to say. First, I really appreciate where Representative Hymanson is coming from, but a lot of this research has already been done, and what we need to figure out now is how are these programs actually going to work for people? And so I think that doing another report is not the best use of resources. I've also think that this bill is so important now more than ever with COVID. I've been single-handedly making sure that seniors in my community have access to transportation because no one is providing rides for them to get food or to pick up their medications. And it's a genuine problem. I spend every day helping people get rides because these services don't exist. And lastly, and most importantly, I do know that the department has the capacity to implement this. They're already exploring a program like it, and they support the minority report because it's an urgent issue for Mainers, and it's the policy that needs to be implemented right away, especially everything going on. So the department is in favor of the minority report, and I will end there. Thank you.
Representative Maxim, thank you very much. Enjoy working outside and getting dirty. That's always a pleasure. So are other people who haven't spoken yet who wish, let me just, good question. We've had a request that Molly Bogart for the department. Do you have, Ms. Bogart, do you have anything to say? You'll have to unmute. Thanks, you're all set.
Sure. I think the department wouldn't support this because of the fiscal note, but in practice, it's certainly something that is formatted in a way that we could implement it easily. So, and also agree, I think in the report we gave you on this issue already, where we talked about some of the ways that we could implement this, that this is a need that folks have. But we're in a similar position financially with with this and other bills at this time.
Thank you. Thank you. Other questions? Yes, Representative Hyman said, I'm looking for people to come be thinking about what they want for a
So
new motion.
Molly, I just want to be clear about what you just said, that the department agrees with this idea, but doesn't have the funds to create a pilot program right now.
I mean, we would need an appropriation to create it.
Okay, okay. So you would look for the appropriation, which would come out of this bill, and my crystal ball says, I don't think it would be appropriated. So does the department have ideas, concrete ideas about which pilot program they could support, or a menu of ones that we could pick from, or how would that be presented to the committee if that were to happen?
Yeah, I think some of that was, and I apologize for not sending this ahead of time, but in the report that we gave the committee earlier this year, that was requested of us in the interim. But I think that this is one of a few ways that ODES thinks could be a nimble way to meet these needs in giving individuals on these services their own budget, and they could identify the transportation methods and mechanisms that work best for them. So whether that's a taxi service, whether that's public transportation, they thought that this is one of the structures that rose to the top for them as they were discussing these options. But it is one of a number of ways to do this, but that it was something that would both be relatively simple for us to implement by giving each individual their own budget, and also something that we thought could meet their needs, but don't have the funding to do ourselves at this time.
Thank you, Mr. Chair.
Representative Craven.
Thank you, Mr. Chair. So I would just respectfully point out that we just voted on a bill that had $20 million in it, and sent that to appropriations for their review. This is really something that's very minuscule fiscal note, and that is so needed. And also, I am willing to push the date out beyond 2021, when indeed I'm sure our economy will have improved by then, and give the department just a little bit more time to implement it. I thank you very much. I don't know if there's anybody else.
I'm just confused.
Thank you. Clarification? Yes.
Yeah, so I'm confused. So the bill itself is a pilot program to be implemented, and it has a fiscal note. I don't have my folder for some reason. It didn't come to me. So, but the fiscal note is to implement a pilot program. And what is the amount of the fiscal note?
500, I believe.
What is it? 500?
500.
500 what?
1,000.
500,000.
Can you see it now? I've put it on the screen again.
Oh, there it is. Oh, okay, thank you. Okay. So the first 8 months of an 18-month pilot project. Okay.
Thank you.
So that's the pilot project without an expansion.
So,
okay.
Thank you. Representative Perry and then Representative Meyer.
Okay, I'm looking at this, and this is just funding for 18 months, I think is what it was. I honestly would rather see the department do the work that it needs to do with other agencies. I can see them working with CAP agencies and others to be able to put something together that would be ongoing. I would rather see them work at that than to put together a pilot project that doesn't have the ability or the time to do that work to move forward. I like the idea of them coming back to us. There's nothing that says in the first one that they can't move forward and do some of this stuff if they can find the means to do it. And transportation, I think, can be done between agencies. I am going to stay with the first bit because I would rather see that work being done coordinated and cooperatively than to have something come up and then die because it can't be maintained the way it is.
Representative Meyer, please.
So the cost, Anna, can you lift that up a little bit so we can see Luke's note? There's a note there. So the cost.
That's my handwriting.
For more than 2,000 members. So the pilot project is more than 2,000 members.
Pilot, well, there are 2148 members in the Section 19 waiver. 60% of them don't have transportation. So that's the population you're talking about, because people with transportation, right? And he assumes an 80% utilization of that. So it's 80% of that 60%. And that's 1,289 members. I mean, it's an assumption, but that's you know, based on good
Yeah.
data.
I see. All right, thank you.
Anna, can you put up the minority report? Again, I don't have my folder.
So this section 1 is in both reports.
This
And
is the majority report?
This section 1 is in both.
Yes.
So this is the majority report only.
Mhm.
And then the minority report is this first section plus this one. And this is the pilot project right here in section 2 for the minority report.
Okay. So the minority report has section 2, the majority report has section 1. Wait, both of them have section 1.
That's
Only
right.
the minority report has section 2.
Exactly.
Senator Claxton, please.
And for clarification, the total spend for this is about 1.3 million because it carries out to that 18 months for the participants.
Right.
Right. Right.
Okay, so
Representative Hymanson?
So I'm again going to stick with it. I just don't see this kind of fiscal note going anywhere. And I would like this to go someplace. So I think having this move along with section 1 so that we get a report back about plans and how this could work is going to be more viable way forward for this excellent idea. I mean, it's a terrific idea. But I don't see having a pilot project land on appropriations is going to go anywhere. So in an effort to have it go someplace, I would make a motion.
Make a motion, please.
So I'll make a motion that the bill be section 1
With the change date.
with a change date to
January 22.
It is a first session,
No.
so you could make it later in the session if you want.
yeah, how about the end of February 2021? Is that too soon?
That's your call.
That would be for a report back. Because if it's any later than February, then we're not in session, you know, then we start to get budgetary stuff. We won't have a fiscal note at all. So I'll say the end of February 2021.
So it's another month. Okay, is that, there's been a motion on the floor, has it been seconded? I would second it. If further discussion, there's a motion on the floor, which is basically section 1 we have before us. That is going to be putting it back to the Department of the Study due by February 28th, 2021. Discussion? And let me just look online, and I don't have a full view of everybody online, but if people wish to speak online.
Okay, so we have, a vote has to be, everyone in the room will be voting the same way we did before. And if you're not here, your vote physically in the room, then your vote will not be registered until you do one of two things. One is physically come and sign your name in it must be in LIO.
Right.
Okay. Or you call up the presiding officer and record your vote.
Which is to say the votes we're taking now are basically preliminary in one sense. They're giving indication where we're going, but not definite.
Right. And will only be recorded for the people physically present in the room.
Right. The motion on the floor. Please.
Oh, Abby's on her way down.
And then if this fails,
then someone can make another motion.
but we really won't know if it fails until you get all the people voting here.
Oh, that's true. Oh, that's true.
But we will have to judge if there's enough people. If it fails totally,
Oh,
then
yeah. Oh, no. Oh. Well, you know what we could do? Before we take a real vote, can we just get a sense of what the vote will be?
Straw poll.
A straw vote. And we can do that without having people in the room. Does everyone understand the problem we're having? That is, if this vote fails in the room, we don't know if it fails outside of the room until everyone registers. So if we do a straw vote now, we might at least have an understanding of if this vote passes or not. Does that make sense in this world of we have to be flexible and figure things out?
Yes.
Yes,
Can-
okay.
Can you
All
unmute?
right. So
Can
if
you put us back on video?
Put yourself back on video, Beth.
I tried. It keeps telling me that I've been blocked. It says you cannot start your video because the host has stopped it.
So,
Allison, could you just tell or the people upstairs are IT consultants. Could you look at Representative O'Connor, Mr. Lopez,
is she blocked on yours?
or Nick or Rick Price?
Did you turn off her video on your?
I don't have that ability. Representative Griffin, we're taking a straw poll at the first right now to see roughly which way this will go. So that we're not hampered in case it doesn't pass by a significant majority, then we can introduce another bill. So Representative O'Connor, can you hear?
Yes, I can hear fine.
Okay, thanks. And we're having IT work on your video.
Cool.
So straw poll, all in favor of the motion, which is basically section 1 with the date of the 28th of February 21. All in favor of the current motion? Straw poll. 1, 2,
Yes.
3, 4, 5. 5 in favor.
Wait, no, there's more up there.
Yes.
Yes, for me too as well.
And Beth O'Connor?
I am a yes.
Yes, so there are 3 yeses there, so that brings it up to 8. And then, thank you. This is a straw poll, and then those against, again, the current motion. 1, 2, 3.
4.
Who's up there? 4.
4. Okay,
But, Rachel, Talbot Ross.
so that equals
So it's 8
to 4.
to
Okay.
8 to 5. Yeah.
8 to 5. Okay.
So that means that we can take a regular vote without risking it. So I'd like someone to restate, Representative Hymanson, I'd like you to restate the motion. We'll have a regular vote.
Okay. All right. Is this what we're doing work for everybody in this? Yeah, okay. So the motion on the table is ought to pass section 1 with a date change.
That's the majority.
Majority report with a date change. Well, it was the majority report. I'm just restating it as section 1 with the date change.
The motion, this is a second.
That was a straw vote.
That was straw.
Now the only vote that counts are the people who are in the room.
Right.
Yeah. You're right. You are right. It was already on the table.
You're right, I'm wrong. All in favor of the current motion?
Those in favor, Representative Perry, Senator Claxton, Senator Bratwick, Representative Hymanson, Representative Griffin.
Thank you. All opposed?
Those opposed, Representative Meyer, Representative Stover, Representative Craven, Representative Madigan.
And yeah, but the people on the Zoom have to come and vote, as has been stated several times, in a different way.
I'm sorry, I need to ask a question about the minority report. I'm assuming that you want to change the date in the same way as the majority report to February. And do you need any other changes to section 2? So it's okay as it is? Okay.
No.
Thank you.
Thank you. So then we're going to go back. I'm willing to go the order that Anna and Aaron have put forth is non-numerical, but we would then go next to 2109, an act to implement the recommendation of the Commission to study long-term care workforce issues. And if our analysts would carry us through that, please.
Okay, 2109. This is a unanimous report. This is the bill that, this is a committee bill that came from the long-term care workforce, but then the committee turned it into a bill. This is basically dealing with the issue of the minimum wage increasing after the Burns and Associates rate reviews and before the department rate review process is completed. And so this is an emergency bill. It's based on $2 an hour for direct care in home and community-based services. All the sections you had in Senator Bellows's bill. It's also in the sections 18, 20, 21, and 29. So the DD, brain injury, etc. Also the PNMIs and the nursing facilities. So it's residential as well. It also includes adult day, the homemaker program, and respite, and it's both main care and state-funded programs. If you care, you can always look at the chart that I put together that's in your 2137 file now, if you really want to see that. The fiscal note assumes a September 1st start date because it has an emergency preamble on it, so it's based on the assumption that you would meet in August. And if it were to come off the table, it would start on September the 1st. So you can see as you sort of scroll through this that it's $2 an hour. The first section is all the home and community-based and state-funded and main care programs. And I guess that's section 2 as well. And then section 3 is drafted slightly differently because they do the rate reimbursements differently for residential care. So that's why it's drafted as to update per diem calculations to increase of no less than $2 an hour. So that's they're the residential sections of main care right there. And you're familiar with all of those. And then the fiscal note is there. So the reason that this fiscal, it's actually a low increase in terms of percentages, but it covers a lot of different services. So that's why the fiscal note is quite large. But this is a unanimous report, and it would obviously go to the table, and it's ready to go if you are okay with that.
Thank you. So this is already, we voted on this, ought to pass as amended. And
yeah, yes, and you saw the fiscal note at some point. I believe I sent it to you
right.
Over the interim. Although this is there is an updated fiscal note once
Does
Luke had a new date.
Does it need date changes or any? That
Nope.
doesn't need anything. No. Okay, so it's ready to go.
Yes, it is.
Okay.
So,
it's
any questions at all?
These things lose their relevance in terms of the policy part, but it's a fiscal note we can put on the table.
So seeing no other questions, thank you.
Okay.
Next, we go to 1760, an act to support children's healthy development school readiness. And Anna or Aaron?
Yep, that's me. All right, LD 1760 would create the first for me, or the early child care and education program. What I prepared for you is the version that you'll see on the floor, which are these first 2 pages. And then, I'm sorry, 5 pages. But the way that that's written is kind of hard to follow if you want to understand what the changes are in context. So in your packets, you have the markup that I sent to the revisor's office, so you could see where the changes were being made. I'm not, unless you want me to, I'm not going to go through each of those changes one by one, but I will say that those changes made were technical changes to make sure the bill was internally consistent, and we discussed those at the work session. And also they adopted many of the amendments proposed by the bill sponsor with that we went over during the work session. In addition to that, excuse me, the committee decided to convert this program from a pilot project to an ongoing program. So you'll see changes removing references to a pilot program. One change that was caught in processing is that this definition of working full-time that you should be able to see on your screen now was used in an earlier draft of the bill, but doesn't exist in the version of the amendment that you have voted on. And so it doesn't make sense to define something if it's not being used anywhere.
Aaron's not seeing it on the screen. I don't know.
It's not on our, Aaron, it's not on the screen.
Oh, it's not? I'm sorry. Let me try that again. Can you see it now?
Yes.
Yes.
Okay, sorry about that.
And go back to where you're talking about, please.
I'm right here. The working full-time definition was a definition that was used in the bill in an earlier iteration of it, but it's no longer used. And so we're taking this definition out. And that's the only thing that was not discussed at the work session. That's changes in this bill. I'm going to go back up to the version that you'll see, the finalized version that you'd see when it comes on the floor, to show you that there are a few dates that just need a committee sign off to make sure that those are still the dates that you want. The first date is at the top here. It requests that projects begin on June 1st, 2021. I know that that date hasn't passed yet, but you may know better than I how long it might take to develop a project and have the department do an RFP and approve those projects to start by next June. So that's the first date for your consideration. The second 2 dates are report back dates that are in October 2nd, 2023, about the goals of the project, and then also that on February 1, 2024.
Thank you. Anything else, Aaron? That's it?
No, I just need to know from you whether those dates are good to go or not. You have a fiscal note here. Also, sorry, there is here, it's the preliminary one that you had when you considered the bill. Depending on what you do with the dates, and given the timing of where we are now in the fiscal year, this may need to be updated after your discussion today.
Thank you very much. Questions for Aaron, and then general questions. We've already voted this. Representative Craven.
Thank you, Mr. Chair. I don't have a question really, but I'm just looking at the first date for 2020, June 2021. And with the way our school systems are at the moment, and it's the uncertainty, how unsure everything is, I would suggest that that's too soon to make any kind of an RFP proposal. You know what I mean? For people to be able to put something together so quickly because of how unsure everything is.
Yeah, I would carry that out another year. I mean, there's so much uncertainty.
It's a very good point. That means, I don't know, Aaron, if you heard that, but putting off everything for 1 year. So 2020, June of 2022, and then October of 2024, February 2025.
Yeah, I got those. I can do that.
Okay. Is there further discussion about that? Otherwise, I did not sort of think about this. Seems very, very reasonable.
All right.
Further discussion on that point?
My only question would be is to ask Molly if the department's okay with the new dates.
Good question. Molly, are you there? Can you answer that?
Yeah, I think this is a big project, and so any additional time that you are willing to give, especially with current challenges, I think we're more than happy to take.
Thank you very much. Senator Moore, thank you for that thought.
So the next thing you'll see on this is a revised fiscal note. And depending on when we see that, it'll either be in a meeting or by email.
Thank you very much. Any other comments from the group here? Thank you. Next, we'll move on to 1856, resolve to support individuals with acute mental health needs.
Okay, this bill has a majority and a minority report. The majority, they're both ought to pass as amended, but in different ways. The minority report is different in only one way, and only Senator Gratwick was on that report. So I'm going to focus on the majority report language insofar as it's consistent among both reports, and then I'll point out the difference after I've gone through that. So both amendments change the reimbursement rate in the bill from $13,396.47 to a reimbursement rate of $10,166 per unique discharge. Both amendments also change the start date from July 1st, 2020 to August 1st, 2020. Both amendments direct the department to seek and apply for available federal funds that you can see here in section 2. And both reports require a report back from the department by January 15th, 2021 regarding the progress on these reimbursement rates. I'm going to scroll down to the appropriations and the fiscal note, which is here. It would, but this number is likely to change given the committee's consideration of the start date for the reimbursement amount, which I don't know if you're okay with August 1st, 2020 of this year, or whether you wanted to change that to a later date. But if that date is changed, this amount is likely to change as well. Continuing on, and then also,
I'd like to stop there just a second. Thoughts about that date at this time? I must say August 1st is coming right up. And what would people wish to do about that? Representative Hymanson, do you have
I don't even know. Can we do, we had talked about changing language like this to like 90 days after passage, or something that didn't reflect a date, but rather.
Yeah, I think what you're talking about is having it reflect the effective date of the legislation, that's when it would become, the new rate would become effective. Which would be 90 days after adjournment. Sorry, I was just checking. I believe that's correct, and there's no emergency.
So does that make sense to the committee? 90 days after this bill basically gets voted in, as opposed to date specific. Seeing no objection, we'll go with that direction. Thank you. Erin,
So
please continue.
Sure. So given that the new reimbursement start date will be the effective date of legislation, which isn't certain yet, does a date, a report back on implementing new reimbursement rates of January 15th of next year make sense at this point, or do you want to change the date of that?
That would.
Oh, I'm sorry, it's 20. Yeah, 2021, sorry. Yep. Is that enough time?
How about the end of February as well?
Or we could have 6 months after the first date. And that was basically, it was 6 months, initially 6 months after the date that this is initiated.
That would mean that you would likely receive that report after or at the very tail end of session next year. And if you wanted to report out legislation, there likely wouldn't be an opportunity to do so in the same session you receive the report.
Good point. Therefore,
Yeah, I think the end of February is probably the last time we'd be able to talk about it, generate something, get it into that session. Without us not being here or delaying it to the following session.
thank you. So yes, Representative Perry?
I guess the question that I would have, because if we have a legislative session in late August, they're going to be able to get started in January. How are they going to report that? We could have that report come later in the session, create a carryover bill, and work at the beginning of the next session. Because this would be the first session of the thing. But I don't even think putting that off a month is going to give enough time to do that kind of report.
I think the report back could be, we don't have enough time. We just, yesterday was the date we started this. So can we have some time? That would be their report back, No, right. But then we could say, all right, now we know where we are. So 3 months from now or something like that. I don't even know how to choose a date.
We could do January of 22. I mean, there's no harm in
We could
putting
do
it off.
January of 22. Okay, all right, January of 22. Yeah.
Thank you. Erin,
Okay,
so you
so
heard the-
I did, thank you. I have further questions on the minority report. You bear with me, so trying to get down to it. So Senator Gratwick, your minority report would have the new reimbursement rate that's you decided would start as of the effective date of this legislation, that it would have a termination date, given that the reimbursement date would start when this legislation became effective. Does the repeal date of January 15th, 2022 for that new rate still make sense to you?
The answer is, as usual, Erin, you point up things which don't make sense. And so that, no, that too would be changed, let's say, to July 1st.
So if that's the case, sorry, I'm going to keep pointing out things that have gaps. So if that rate ends July 1st, 2022, and you don't get a report back until January 15th, 2023, there will be a gap of about a year between when the reimbursement rates end and the report is due. And also if the rate will end at the end of session if the committee or if the legislature chose to change the rate. So you wouldn't be in session to handle the end of the reimbursement rate or
Right. With apologies, I'm having a hard time. I need to write down all these particular dates in order to get the proper sequence. If you have that in mind, Erin, I'd be happy to listen to your suggestion. Otherwise, we could talk after this, and I can. I'll just write them down, and we can, when we bring this back, we could deal with that.
If it's okay to say, can I share on mic, Senator, what you and I had spoken about for dates previous to this meeting? Is that okay with you?
That's fine with me.
We talked about you changing the date to January 15th, that the dates would, excuse me, the new reimbursement rate would terminate on January 15th, 2023, and that you would receive a report back still in 2022, earlier in the session, so that there would not be a gap when the rates would go away and if the legislature chose to act.
Thank you. That sounds fine to me.
Okay, thank you. And then Senator, also, I made a drafting error because this is a resolve. It's not really a repeal, and I wrote it like repeal language. So you're going to see on section 1 of your amendment, it's going to show, if you're looking at the screen now, that new rate of $10,000 per distinct discharge is in effect until the January 15th, 2023 date that we just discussed. So you'll see that full thing marked up as opposed to using the language repeal. But that's more of a technical fix, but it's going to look a little different. So I just wanted to explain why.
Thank you. That's fine.
That's all I have on that one.
Thank you. Any other questions? Thank you all.
Can I say I got
Yeah.
kicked off? I guess I'm gonna come back on somehow.
Okay. We're guessing ahead and waiting for Representative Hymanson in just a second.
That's all right. Go ahead. continue, and
1943,
I'll
an act to
figure it
prevent protected drinking water for low-income Maine residents. 1943.
Yep, so that's should be on your screen right now. I hope I'm still screen sharing. You authorized me to work with Andy Smith, the state toxicologist, in the department, and I also worked with Luke on OFPR and putting this together based on the committee's discussion at the work session. In general, this amendment, which was a unanimous, ought to pass as amendment. It establishes a free well water testing program, and it establishes a certain amount of money that was estimated by the department to come up with a targeted mailing campaign of $51,487 annually to people to have a comprehensive well water test. So I'm kind of gonna show you where those are in the amendment so that you can kind of follow along. And then I have a date question, a report date question for you, and a more substantive question for you. Okay, so just skipping ahead so that we can get to the meat of what you're talking about. Section 2 is the section that establishes this new well water testing program, and it directs the department within available resources to provide that testing program. It directs them to develop a targeted mailing campaign to implement the program. It talks about the tests needing to be comprehensive, both for contaminants and radon, and that the department may not require justification for the testing from a geologist or a physician, and that those well water tests are free and not subject to a fee. So what the within available resources language does, and confirm this with Luke, is that it restricts the fiscal note amount to that 51,000 number. So we don't have to define in statute what low income means for people who this might be available to. It gives the department flexibility to target, given their various programs, target their outreach to people that would be both eligible and in need of a well water test. So going back up, if you see section 1 here, this just removes the this new well water testing program from the typical fees framework. And then there was just a technical drafting change here. Every once in a while, drafting standards change and the revisor's office takes an opportunity to amend sections that we're amending in legislation. So this is an example of that. It doesn't change the meaning in any way. Section 3. So we talked about section 2 first. Section 3 similarly exempts the program from the typical fees framework. Sections 4 and 5 are technical amendments to add another paragraph. So this is the substantive question I have for you. Section 6, and I know you're not seeing it in the full context, but this is amending the section that has the private well safe drinking water fund. And it's a fund that exists to allow the department to use money in that fund for a variety of purposes. This was not something that the committee discussed, which is why I'm bringing it to your attention, but it came up in discussions with the department as part of making sure the amendment captured, I guess, the intent of the committee to have the well water tests accomplished. So by adding this new well water testing program under this drinking water fund, it allows the department to use the fund to supplement the appropriation of $51,000 if that amount proves to be inadequate. But if the legislature, and certainly this is a committee decision, this is your prerogative, if you do not want the funds in the drinking water fund used for this purpose, in addition to the other purposes already established in statute for the fund, then Section 6 can come out.
Thank you very much. That's something I would not have picked up myself. Other questions? Yes.
Yeah, so can you remind us what the other use of the well water testing fund is?
Yeah, I'm pulling them right now. Sorry. Currently, so funds that go into the private well safe drinking water fund come from fees collected from other tests or other funds appropriated by the legislature, or any donations or grants from any other source. And expenditures from the funds are restricted currently to improve the rate of testing of residential private drinking water wells for contaminants or properties that are specified, or educational outreach programs that are consistent with the statute, or to defray the department's costs in administering the subchapter and waiving fees. And the funds from this account are reviewed, expenditures are reviewed upon the advice of an advisory committee established by the department.
Okay, so they're not, I don't want to over tap them or have somebody say, what, you know, we don't have enough money in there for its usual purpose.
Mm-hmm.
Do we know anything about its usual purpose, and if it's okay if we tap this?
I do not know that specifically. I just know that in my conversations with the state toxicologist, it came up as a possibility that in this context would give them more flexibility, but it wouldn't be a requirement of those funds to be spent on those.
Yeah.
If the advisory committee advised against it.
Okay, so there is an advisory committee that oversees this fund. I just don't want to over tap it. It sounds like it's a good use of the fund. And there's an advisory group that looks at the spending of this fund. So it sounds okay to me. I haven't heard or explored that before. So I suppose if we do this, we'll hear about it.
Yeah, and I mean, and if you're not comfortable with it, it can come out. It just came up because you authorized me to work with Andy.
Well, so. It seems to me that we haven't really explored that, and I don't want to do. I mean, either we could go ahead, you know, that idea that you do something and have somebody tell you you can't do it later, or you don't do it until you find out if you should do it. I don't know. How does everyone feel?
Other thoughts from the committee about this?
Well, I think if they suggested it just as an alternative, it's an option. It's not a mandatory use of it. So I say we leave it in there personally.
Thank you. Thank you, Senator Moore. Other questions? Other thoughts on that? Right. I mean, it does come from them as opposed, and so if it points up a large issue, I think we'd deal with a large issue.
Okay.
Thank you. Erin, please continue.
Okay, so given that that's staying in Section 7, which is in the section of statute dealing with that private well safe drinking water fund, the department pointed out to me that this division, environmental health, within the department, that this division name isn't accurate. And because division names can change, et cetera, that it would be more inclusive and more accurate to just refer to the department to expend funds with the advice of the advisory committee, as opposed to referring to a division that is not actually doing that work.
Thank you.
And then you have the report date here. So this requires a report, not this coming January, but the following January, about the program to provide well water testing and the results of that. And so I know this date hasn't passed yet. I just want to make sure that the committee is still comfortable with it.
Any questions from the committee? Sounds reasonable, Erin. Thank you very much.
And then just so you can see, I mentioned it already, but you see the appropriation here, a specific amount of $51,487, which is reflected on the attached fiscal note, which I confirmed with Luke will not need to be updated, even given possible later enactment than was anticipated last session.
Good. Thank you. Other thoughts? Erin, thank you. Any other thoughts from the committee? Let me just check through the visuals. All set? We will next turn to 1954, an act to amend the laws governing estate recovery under the main care program.
What number is that?
1954.
So this bill was unanimous, ought to pass as amended amendment. It clarified that hospital and prescription drug services must be related to a member's receipt of nursing facility or home and community-based services, rather than just general receipt of those services, so that they would be subject to estate recovery only for those limited services. And that in the work session, you discussed the department adding a date certain to address any potential confusion about ongoing estate recovery cases. And that date was going to be 9 days ago. So that date is before you to consider whether it should be changed to a later date.
Maybe we could do that 90 days after
The bill is enacted.
the bill is enacted.
Yeah.
Please.
You mean the effect? So the effective date. Yeah.
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 Thank you very much. Any other comments on this one?
I just wanted to show you the fiscal note as well. As a result of these changes to the estate recovery program.
Okay.
Okay. Thank you. Yes, that's
Just
the
it's going to shrink again if we change it from July 1 to adjournment plus 30 to 90 days.
Yeah, you're likely to see an amended fiscal note on this because of the date change.
Thank you. Next, 2056.
Always look for a silver lining for a viral pandemic. It shrinks your fiscal notes. Oh boy. All right.
So this bill is also unanimous, ought to pass as amended. I did attach the original bill, which is here. The only thing so what this bill does, it creates a collaborative to develop a plan to house 200 persons experiencing homelessness. Going back up to the amendment, the only thing the amendment does is change paragraph 6. It changes the membership of that group to include a member representing municipal officers. That's the only change. But in reviewing this bill, I'm going back to the original bill, it has a report back date of January 1, 2021. And I'm putting that in front of you because that may not be enough time to have this collaborative develop a plan now that we're a leader in 2020.
Suggestions been made to put it off 1 year. We could either 3 months after, put it off for 3 months, or I must say having more time rather than less seems very important on a bill like this. I like the idea for Representative Perry of January 1st, 2022.
Okay.
Yeah. Is it
And
general agreement? Senator Claxton concurs. Senator Moore concurs. Okay, thank you. Yeah.
So we don't have a fiscal note on this yet, but once I send the new report date to the fiscal office, you should see that as well.
Thank you very much.
Can you remind me how we're going to do that? You're going to send the fiscal note by email, and then you'll give us 24 hours to respond. If you don't hear from anyone, then they go out the door. Is that what we're going to do?
I think it depends on when we receive the updated fiscal note. So if you receive it and we're able to review it in an upcoming committee meeting, we will do that instead of by email. But email is certainly what we do, like at the end of session when we're not authorized for any more committee meetings. There'll be a period of time to review it before it goes out the door.
Okay.
Thank you. Next is 1418. An act to address Maine's shortage of behavioral health services for minors.
Okay, LD 1418. So this is Representative McCrate's bill. This is the issue of children being stuck in emergency departments waiting for behavioral health services. And this amendment was originally drafted in a bill in a different section of the statute, and we moved it into the Children's Mental Health Program chapter, which is actually called the Children's Behavioral Health Service, which is within OCFS. So we talked about that at the work session, that it would be likely moved into there. So this has a couple of parts to it. The first one, and I'm just going to move down a little bit here because the definitions are. So this is about hospitals providing information to the department, and then the department would post that aggregated annual data without identifying the child or the family. And it would be looking for the data of the number of children that are stuck in emergency departments for more than 24 hours, the length of stay, so how many days that is, and the reason why they were stuck there. And then it establishes this coordination by the department section, where the department would designate coordinators that have responsibility to facilitate the provision of appropriate services as needed. These are actually positions that already exist. They just didn't exist in statute. So we're not creating new people here. We're just putting it in statute so that you can refer to them later on. And then you would be requiring an annual report from the department with that annual compilation of how many children, how long, and why. And it would, so this is an annual report, so it's in the statute. So it would begin, the first report would come to you on January 1st, 2022, and every year after that, as long as you're still okay with that date. And then you have this unallocated section of law. Because we know those coordinators exist already in OCFS, the Children's Behavioral Health Program coordinators. They are not currently terribly well known about, is what you learned at the work session. So this would be requiring the department to find ways to use them sort of more effectively, and then report back to you how that went. So this is a one-time report. So this was going to be required on January 1st, 2021, which doesn't seem like enough time. I didn't actually suggest the date there of January 1st, 2022. I believe that was in conversation with the chairs, but that was one of the possibilities. It doesn't seem like that would be sufficient time to do that particular report
Yeah,
You
so
might
I
be
think-
okay. Yeah, you might be okay with the first one, but this one is a problem.
Yeah, 2022, I would change that and have them both be the same.
So just remember, this is a one-time report. The first one isn't, so they are separate reports. This would be, the idea here is that you'd get 2 reports and then you would get one that would keep coming. So they don't have to be the same, although certainly they could be. And this would make the first report the same. And then after that, you would get the annual report. So if you're good with leaving the statutory date at 2022 and you want to change section 5's report to 2022, we can do that.
Any objections at all? That seems very reasonable, 2022. Thank you very much, Anna.
Okay. And just to make sure that you can see that there is additional costs are expected to be absorbed.
Yes, thank you. Next is 1936, an act to allow parents of minors who qualify for in-home personal care under main care to be employed as caregivers for those minors.
So there are 3 more. Are we okay plowing through?
Yes.
Is everyone okay with that? Okay, yeah.
1936. So this was a unanimous report allowing for parents of a minor child the minor child qualifies for the in-home personal care. And this would allow for the parent of that minor child to be paid. So this amendment was really to sort out there was a drafting issue with the first one. So this has been rejiggered to put the conflict of interest in the right direction. And so the parent would be the employee and an employer would have to be designated by the department and the parent. So mutually agreed upon by the department and the parent. And this is to avoid a conflict of interest. This is a particular issue because you are taking care of a child. And so the department would have to seek CMS permission within 6 months of this act going into effect. Then the department would make rules within 6 months of the approval by CMS. And then there is an interim report that is due no later than March of 2021. And then a final report with hours of care provided, cost and savings. That is by the 1st of January 2024. So the question is whether you want new dates here. Just a reminder once again that whatever you choose needs to fit with the legislative calendar. And then there is a new fiscal note. You can see that struck out there. Here is the new fiscal note. And this is based on a November 1st start date, which is the date that OFPR are using or Luke is using for non-emergency bills right now. So you need to decide whether these dates for the reports make sense or not.
So the answer is there a reason not to put those off for 1 year as well?
No, they look okay to me, actually. Yeah.
They do.
March 2021 and no later than January 2024. Yeah, I mean, it's a progress report in March. Yep. So if they come and say, we haven't made any progress, that's a progress report. And then we can.
Yep. And all the other dates are drafted as, 6 months after this happened and 6 months after that happened. So you don't have to worry about those particular ones.
Yeah. Okay.
Thank you. Any other questions? Next, 1984.
Okay, 1984. This is a unanimous report. This is Senator Millet's bill about wait lists. So this has a number of pieces to it, and somehow I dropped off the summary. I'm sorry about that. The number 2 and 3 dropped off the summary. So this bill does this amendment does 3 things. This is what you agreed to. So there were 3 pieces to it. You provided funding to clear the main care section 29 wait lists through the end of the fiscal year 2021. If you remember, the supplemental budget cleared the section 29 wait list up to December of last year, and you had heard that there were a couple of months of extra funding sort of available, so you needed to fund 16 months more of the wait list. Secondly, you were increasing the cap on section 29 to 70,000, and thirdly, you were providing Section 21 services to individuals on priority 2 wait lists with no services. So a reminder of sort of how all the numbers work, and let me just, most of this amendment you can see is the fiscal note, and I do want to come back to the Section 1 piece here in a minute, because one of the things that you voted during the work session was to have the cap for, I guess, basically a 4-year period, so I do want to come back to that sunset in a minute. So the fiscal note, this is the appropriation section, which is why I put the appropriation section before the final fiscal note. So it has some positions in it. And then you have, this is the piece of, there are several pieces of this because it comes out of several accounts. You know, there is federal funding, other special revenue, and general fund funding for each of these pieces. So this is the part that would provide funding or provide Section 21 services to those who are currently designated priority 2, but don't have any other services. And the fiscal note is based on 187 individuals. That's how many there were as of 12/31/19, which I guess is the number, the date that everybody agreed to. It's the best way, it's the only way we can really know how many. Obviously, there are some people, and this is a one-time clearing of the wait list. So this doesn't clear the wait list forever. It's not about all priority 2s with no services. It's those who are priority 2 with no services as of December 31 of 2019. And then the next section, this is the increase the annual cap to $70,000. Now, there, just as a little bit of history, because I think the numbers at the work session about what the current cap is were not actually accurate. So the budget in 2017 increased the Section 29 cap to $47,500, but through a series of 2 or 3 rulemakings since then, the current cap is $58,168.50. So this section is increasing that cap from that number, 58,168, to 70,000. Now, the fiscal note is, of course, more complicated than that, because, as you know, the cap is a cap. It doesn't mean everybody's sitting at the cap. You know, there's a sort of average amount, and there are some people who are getting $25,000 worth, and other people who are using every dollar of it. So the way this fiscal note, the assumptions are that there are 14% of the current individuals on Section 29 who are at the current cap, and they will, and the assumption is that they will go from 58,168 to 70,000. In addition to that, you are clearing the wait list for the biennium rather, of Section 29. So that means there are, all of those people will have the possibility of going up to a $70,000 cap. So that has to go and be factored into the fiscal note as well. Luke said that the assumption is that 122 of those people will at the new cap. And just to refresh your memory, there are 400, an assumption of 480 people. If you remember, the conversation with Paul Saucier was that there would be roughly 30 people a month or 1 a day that come onto the Section 29 wait list. And so the supplemental had included 362, and this is based on 480. So the assumption is that 122 of that number would also be at the 70,000, and the, you know, not everybody. In other words, the fiscal note is not based on $70,000 for every single person who is coming off the wait list, and it's also not an assumption that every person who is currently receiving Section 29 will go to 70,000. So that number would be considerably larger if we had to assume that, but we don't. And then this also came with a sunset. Now, the sunset doesn't affect the fiscal note because that 4-year period is beyond the cycle of the fiscal note. However, what I learned after the work session, and we never got to have this conversation, is that the concern in ODES is that CMS wouldn't approve that particular amendment of going up to 70,000 on the assumption that it was going to go back down, because that reduction in services would be something that CMS wouldn't approve. And of course, Paul also said that the department is working on, you've heard a lot about this, about the idea of a single waiver, and they believe that they will have done that work by then. So they don't think that they need the sunset either. So it's drafted that way right now because that's what the committee voted. But you could take that out if you like. It doesn't, I don't think you would need to revote it if you want to do that, as long as you all agreed. But it does, it wouldn't make any difference to the fiscal note because it is beyond the period of the fiscal note anyway. So that's, I'm just letting you know that's what I was told, but it's up to you what you want to do with it. And just a couple of extra things before
I would say if we're okay with that, if we just strike that, the sunset, if that's going to get in the way, if people in the room and on Zoom are okay with striking that sunset. Yeah.
So we would strike that sunset.
Okay, so what that means for the drafting is when you go back up to this top page, you don't need this first section here at all, because everything else is in the fiscal note. All the blippies describe the 70,000 and the clearing of the wait list. So this will be an amendment that is solely an appropriation. And just one last thing is the original bill had an emergency preamble, so this has an emergency preamble as well. So the fiscal note does have an assumption of a start date of September 1st of 2020. And there's also positions in this, as I mentioned. So that's all the pieces of the fiscal note. So just as a refresher, clearing the Section 29 slots, raising the cap of Section 29 to 70,000, and put it those that are currently on the Section 21 wait list who are priority 2 and no services. Those are the three pieces that are in here.
Yeah. And as I understand it from discussions with Molly, and you can say if I'm wrong, Molly, that we were able to fund Section 29 past the January date because of changes in section, the way that appropriation to people on Section 21 were made. So that's good news that we didn't need this to appropriate it. We're still taking care of the people on Section 29. And the other is that the third part of this, our intention was to find this group who are vulnerable to being in the first category, but it really didn't work out that way. So it's a little bit sloppy in terms of policy, but again, it'll be an appropriation for the committee and we can make that known to them. Did I get that right, Molly? Did you want to? All right, thank you. Thumbs up.
Okay, thank you very much. Any other comments? Good. Moving on to the last one, 2063, please.
Oh, I didn't want to share that really. I'm sorry, I'm just trying to pull up my last amendment, which I can't seem to find. Here we go. So 2063 is here. So this is a technical bill, so I'm not going to go through all the details of this because you don't want to hear them all. Let me just remind you of the substantive. There are only 2 substantive pieces to this. So this is the technical licensing bill. Most of the changes in the amendment are actually technical and organizational. I don't know if you can remember back to this particular work session, but this is the one where I pointed out that there were all sorts of really odd things in the way that the bill was drafted, that we started sections with number 4 and put things in weird places. So most of this amendment, well, first of all, you did ask for an emergency preamble, but most of these things were technical. I'm going to run back up to that in a minute, but most of this stuff was just putting things in the right places that had been sort of missed. But the one substantive change that you did make was the original bill. This is a section of lodging place, if you remember. So there was an agreement between the department, Hospitality Maine, and the campground owners. The bill was originally drafted as 90 days of a definition of permanent residence. And just remember, this is permanent residence for the purposes of licensing. It doesn't have anything to do with taxes or immigration or any of those other things. And the agreement was 183 aggregate days a year. And so you went forward with that since you had gotten agreement from everybody. And so that was the first substantive change. And then the only other thing, and there's a reason why this is written up at the top here, was you also put in, the original bill had some language for a public records exception, so confidentiality for complaints, basically, for licensing purposes. And it wasn't drafted correctly in the original bill. It's still not really drafted correctly, but this language was also changed to, you changed the language for the licensing, but it was also extended for the professions that are in here, the Title 32 professions of electrologists, tattoo artists, micropigmentation, micropigmentation and body piercers. So you put the same language that was for establishments, in other words, restaurants and lodging places, into those four, and because and that was going to require a public records exception review by the Judiciary Committee, which is not really the point here, but it was extremely broad, really, well, it was actually really detailed, but it was extremely broad in terms of its confidentiality provisions. Much.
So can I just say something? Because we did review this because it's a department bill with Molly, who reviewed it with the department, and we asked, is this still relevant? Is this bill still relevant? And I think there's that part of it which may not be relevant, so we may not even have to talk about that. But Molly, could you comment about that?
Sure. So yeah, thanks to Anna for flagging some of the items that would need to go to judiciary for us. And I think the health inspection program and the department would appreciate continuing to pass this bill, just less those items that would need to go through judiciary. If we determine that those are still necessary, we can always come back to you next year.
Okay, so how would we handle that? Can we, as a committee, say strike the issues that need to go to judiciary?
You can, because this is amendment review, and if you decide that this language is too broad because the department are going to come back with different language next year, you can just say, you know, we don't want that after all. And I just want to mention that I know I put 20, 30, 23, 27, and 31, but it's actually also 16. Section 16 is the establishment piece. So those five, if you want to remove those, this is still in processing. You can tell by the fact that it's not perfect. See all these little markups here? This is because it's partway through the process in the revisor's office. And I told them not to look at this particular section too closely because I had wanted to come back and talk to you more about it, as well as the department. And I also had some quick conversations with Ann Head about it, although we never quite got to the point of connecting. So yes, if you want to remove them, you can. And I will just...
As long as the committee is okay with removing all of the parts that would need to go to judiciary because the department is okay with removing those pieces. I just look for head nods and I guess we can just change it. Is that all right?
Yes.
Okay, thumbs up. I see some thumbs up.
We discussed this in detail before, and that's the very reason.
That sounds good.
Thank you. Anything else?
If anybody does have a problem with that, let me know, because I can always pass that on to the chairs if somebody, you know, because you've all had to turn off your pictures and all the rest of it. If there's an issue, just let me know.
I see. Thank you.
Okay, thank you very much.
So that's the last of the bills we have for amendment review. Phew.
Yes.
I'd say we've had 4 very intense hours here. And I want to, I guess, just as we finish, just my personal remarks, and then with apologies, I have to leave rapidly to get a ferry, which the ferry will not wait for me. And so, but I just want to thank everybody, the staff, the people in the building here, the committee members, both present and far away. This has been very good. And specifically, we're going to be meeting next Wednesday again, 7:15 at 11 o'clock again. And if people have suggestions either people who are on Zoom, people who, the interested parties, advocates, etc. If you'd be kind enough to get to Representative Hymanson and me before our next Wednesday, if you think we need to change this format. And with that, I turn to Representative Hymanson and others.
No, I'm good to go.
Okay. Other comments? Senator Claxton, Representative Perry, Stover, anybody else online who wishes to speak and give their final swan song? With that, then I would thank you all very much.
We need a motion to adjourn.
An unusual
We
pattern.
need a motion to
Representative
adjourn.
Stover, are you going to make a motion to adjourn? Representative
moved.
Stover, make a motion to adjourn. Thank you all.
Just
Bye, Abby. Bye, everybody. Good Lord.